Hi friends, good evening. This is your host Ankit Khanilwal joining you from Delhi, India, and we have our senior executive producer from IBM TV, Kimberly Calhoun, my co-host, joining us from North Carolina Valley. And today's Med Friday with doctors, and we are having a great lineup with all the doctors sharing the best practices around the world during COVID and post COVID 19, and how we can save this world and create a better future for our newborns and people around us. And so, Kim, how is US doing?
Well, not so healthy.
Not
Uh,
so healthy.
Not so healthy. If you take a look at world emitters, and of course, there's a debate about, oh, they're reporting every death as COVID. That's not true. They're doing, every death is COVID or every infectious, anyone being admitted into hospital is COVID because that's the only way Medicaid. And that's not true. According to the doctors that I have spoke with, we need to have more respect for our doctors. I don't think they would just label everything COVID. Two, you have to test positive for COVID before they even would put that on your death certificate. And quite honestly, if you went into the hospital tested positive as COVID, but we know that you had other diseases like heart disease, diabetes, so there are other complications. But you died while you were there because you were tested with COVID, then I'm going to say yes, you died because of COVID. Your diseases were probably compromised, but you
Yeah.
died because of COVID. So, people get off your high rocker about this political BS. I don't think the doctors are making up the cases just so that they get more money. The problem is that a lot of doctors that are having to see high rates of the infectious diseases don't have enough proper equipment. I mean, that's the
So,
biggest problem. And then I hear, well, we've got plenty. Well, then fine. I think someone needs to get together, a real leader, and say, okay, well, let's do an accounting of all the medical supplies in the country, like you would do for the military, right? We know what's in every locker in the military, what's in every supply closet, and we say, okay, we have a situation here, a cluster situation here. Let's take from here and share here. It shouldn't be that difficult to do an accounting of everything in the country. Where I've heard, some hospitals, we got plenty of ventilators, and other hospitals, we don't have enough. Well, get off your duff and ship them. Account for them. Say, do an accounting receipt, right, so that you get them back. But this is not a time where you need to think about your own profit or anything. We need to work together to save the world, right? We need to be one. But let's take a look at the world meters. Do you want me to do it, or can you?
I'll do it. I'm just opening that only.
But if you take a look at the world meters, we're not doing something right. And unfortunately, it hit New York too hard and heavy, and you've got a resistance going on. And with the resistance, you're not going to see a positive, positive return. So, what we need to do is we need to focus on what is working, the footprint that's working. And also, somebody pointed out to me yesterday, I mean, look at UK. Well, oops, they're not reporting again. Why is that? Some days they're reporting and some days they're not. But the UK
Right.
has the highest fatalities per 1
Yeah.
million. So
Yeah.
if you look at UK, they're definitely having a problem. Italy had another spike from what I gather,
Yeah.
but I think it's because everybody kind of started letting their guard down, and they started doing reentry without good practices. And what we've learned from the studies, from all of the doctors, we get a lot of positive feedback. One thing is early detection is very important, right? So testing is very important. There's a lot of people who say it's not, but we test for diabetes. Sometimes people test 3 times a day. Why? Early detection of a problem, so that
Yeah.
you can fix the problem. Early detection for cancer is very, very important. Why? So that you catch it before it spreads inside the body, and you can protect the person from dying, maybe give them a little bit longer time to live. So early detection is very important. Despite what everybody's saying, our own leader gets tested every day. Even if 5 minutes later you can get infected, if you're testing every day, the next day you might know about it. Um, we get a lot of negative feedback from people. Well, the test results are only 85% accurate. Granted, if that's all their accuracy is, that's still better than not testing at all. And if you're testing every day, then the odds are you're going to detect whether you have it or not. I would say do a two-tier testing like you do with pregnancy. Do the rapid test at home, and then if you are tested positive, do the second tier testing, which is PCR. And I'm told that they've gotten the PCR test in such a way that usually within 3 days they can get your test result back now instead of the 10 to 14 days. I've heard it go as long as 20 days. But I think that if they implement a testing lab in every university, all right, every university has a testing lab that so that you would, and I'm not talking just major universities, I'm talking tech schools too. If you have a testing lab, then you've got a local facility, right? Take it out of the hospitals. You don't want this going into the hospitals. Get the test results in and out of the universities or tech schools. Now you're putting them to work. They're putting them to real work, right? Like real application situations. So their degree will mean more when they come out of that university. So let's take a look at this. Look at the stats. Ankit, what do you think?
I think, we are not following the practices of how to restart the economy. And also, we are not learning from each other, because I'm surprised to see Russia at number 3. And you can see India at number 11, I think. It's at 11. So, it's more about we are not sharing the information and we are not learning from each other. And that's why we are seeing these numbers growing up like that. I know we have already, the virus already spread and it's a pandemic situation. But still, if we try to sort it out one by one, if we try to plan things in stages 1, stage 2, stage 3, and based on the stage 1 planning, we can work out on the stage 2 and we optimize the way we optimize in the IT and telecom industry. We need to optimize our day-to-day habits, and then based on that, we can plan our next day. So we have to have small plans, and then based on the small plans, we can plan a bigger plan. Because if the number is still growing, and there is no point of opening the economy. Because we were down for like 2 months, and then after opening up, if we find the cases are spiking up like anything, then we are not. Whatever we have done in the past, whatever the good work, the lockdown we have done, it's all zero. Because we did it to save the economy and to save the people. And if we are not able to continuously doing that and working towards that, I think we are not doing good. And I'm surprised to see cases are growing in UK, in Italy. You can see. I think we are not getting reports from Italy since couple of days, and some off days are in UK as well. France also the same thing. We are not getting reports. And small countries like Turkey, Iran, and Peru, so they also have cases going up like anything. So it's
usually they report. So I'm at odds. Recently, some days I see this blank, and some days I see it, and it looks like it's jumped up tremendously. But when you still take a look at the total number per million, that's where you need to focus on, not just in particular how many per country, but per million, per capita is what you should be taking a look at. Also look at the density of some of these places. Also take a look at their medical care system. Is their medical care system capable of handling this? Do me a favor and find Africa. We're not Africa, South Africa. Africa is a continent, so we can't count all of Africa. But go to Nigeria, go to some of these places, because I was listening to some people from Uganda and a couple of other places, and they were talking about how they're maintaining it. But let's take a look at them. What have you got here? Japan? Is Japan still total per population? Total. So,
but Kim, tell me one thing. So if suppose India has a population of 1.3 billion, that means 1% in India is not equivalent to population of Hong Kong. A person from Hong Kong and India, are they equal?
So when you're doing it per capita, right? So what you're doing is a ratio now. So you're saying,
no, I understand all the per capita point, but my concern is one life in Hong Kong is equal to one life in US is equal to one life in India?
No.
No.
No, not well, when you not when you do it by the country, but when you do it by per million, yes, it's one to one. So if we're looking at 1 to 1, then yes, that by if we're looking at by population by 1 million. But when you're saying 1 to 1 in a country, no, I don't think so,
So,
because um, but in some ways, maybe it'd be kind of like counting votes, right? So maybe yes, it could
so my
be.
concern is that my concern is that I'm okay with all this data. I'm not against it, but my because everyone is talking about mortality rate, people are talking about cases in 1 million and cases deaths in 1 million, and the total test in 1 million. That is just to come up with a figure with 1 million, because they can't talk about bigger figures. So they just wanted to contract and talk about a figure which is equivalent to 1 million. But a country like Hong Kong, they just have 7 million population.
So South
Okay.
Korea got hit really bad. Look at South Korea, even though but I don't understand this, because look at South Korea. They show 11,000 total cases, right? And new cases 27, and a total death of 250 people in South Korea. South Korea must be really small, because when you scroll over to 1 million population, is 14,000 people for the 1 million population. So South Korea is very, very small. So I would say that this is not a fair evaluation for them. But if you're still looking at odds, that's a lot of people for a small country. But the thing is I think the smaller countries, they got hit early, right? So you have to remember that they got hit when there was no idea of what to do with it, how to maintain it. The hospitals were not prepared for it. Doctors were not prepared for it. Take a look at Australia, where Willie's from. Let's take a look at Australia.
So Australia is 98 deaths so far and 7,000 cases.
And see, there's something wrong with this 1 million population total. Something's not right. Can we reset world? I don't think so. I think they're in the middle of resetting. So can you? Because I think the calculations are off. There's something wrong here. So let's just.
What I can do is I can sort it. I can sort it as total cases in 1 million. So if I do that, you'll get a better figure that how countries are doing.
Or just do a recycle and see if it resets the button, because I caught it in the middle of resetting the other day, and all of the numbers were way, way off. And we've got Rakesh on this morning. Good morning.
Good.
Good morning. Good afternoon. Good evening.
It's night, yeah.
Yeah, exactly. Good evening. So hopefully you've had your dinner and so
finish my walks and then
wow, see? What's it like in Hong Kong? I know you said that your building has a quarantine label on it. But
not our building, but my sister's building in Bombay. Bombay. Not here. Here we are fine. We're okay, completely fine. I go every morning, drop my wife to office, and come back in the evening. I pick her up, and during the day I work on my website. So I've made some progress on that, so I'm happy. Then I walk on the website
with the world and let the world know how they can reach you. But so we're looking at the numbers, which look way, way off to us, and some of the numbers have not been reported. UK now, yesterday UK was reporting, and today maybe they just haven't received their numbers yet. But I just find it hard to believe that Germany has 37,000 total per 1 million population that are infected. So I just find
something's wrong there.
there's a problem with the calculation.
Oh, those are the tests.
Oh,
those
no.
Are the tests. Because everybody's wrapping up the tests.
Okay, there we go. Okay, duh. Okay, got it. All right. I'm tired today. For whatever reason, everything I look at looks way off. So okay, let's go back over. So let's look at the deaths per 1 million. Now, if we just move over a couple columns, there we go. Now I got my eyesight right. So that looks more accurate. So
That's
the
more
US,
accurate.
yeah, unfortunately, Spain just had a horrific
Yes.
climb in not just cases, but in deaths. I mean, if you look what happened, there and again, they've only done about 2 million tests. And this is something that I've been talking about. Even our president is testing every day, and people go, "Well, you can test now, and 5 minutes later, you get sick." And I go, "Yeah, but early detection is very important." So that's the reason why people with diabetes may test, more than once a day, because you can get ahead of sugar dropping.
Yeah.
That's why you test consistently for cancer, because early detection of cancer can prevent it from spreading. Well, you
There
want
is no doubt. Testing
early
is a
treatment,
must.
right? Treatment.
You
So,
know?
and hear me out on this. The test kits, and Kit and I know that the test kits on a wholesale value, which we could probably do it if we get Walmart or BJ's or Costco to pick it up. But the test kits on a wholesale are right at $10 for a package of 25. So you could test yourself for 25 days for $10. And, maybe they'll throw another 5 in there and you got your whole month, right? But for $10 for a whole month, you can test yourself. We do 2 things by doing this. We do early detection so we can do early treatment. We know early treatment will prevent people from having to go to the hospital, having to go on respirators. I mean, you're not going to 100% prevent it, but you're really going to reduce that rate.
Yes.
And then it's going to prevent the spread, right? You can quickly trace back where people have been. And I think one of the reasons they have not been doing that much in the US is because everyone keeps crying, my privacy, my privacy. So there have been a lot of not tracing back of everyone who's been detected with the virus. The other problem I had is people who were detected with the virus, all they had to do was sign a waiver saying, I promise I won't go anywhere. There was no way to trace whether they did or not. And I'm going to be quite honest with you about people here in the US. Love Mark, who was on our show yesterday. But just like he said, people go to work sick. People are going to go to work with COVID. They are so self-entitled in the US and have this, my civil rights attitude, my civil liberties, that they're going to go to work sick and they don't care that they spread it to everybody else. They just don't give a hoot. I hear this every day, and me. So, and Kumo, I want to pull up his video. His speech was profound. It was, what happened to we? The lady kept saying, that the amount of people dying doesn't matter to the amount of people who need to work and get a paycheck. That's what she said. I don't care. The risk of people dying, this is what she said, the risk of people dying is not enough. There's not enough people dying to prevent us from going to work. Oh. And that's the attitude that our president had, right? That's the attitude he had in the beginning. I think now.
Remember, they said while presenting, I think in April, that they are okay with this number of deaths. Remember that line? And I don't want to mention it, what number, but and we discussed that day, that how can someone is acceptable with these deaths? And that's what I was trying to understand, because I'm still not able to understand. How can we discuss death with per capita? We can discuss per capita maybe just to analyze the situation and to make sure that we are doing the things right. But a death in Hong Kong is equal to death in India.
Well, because this is the attitude that the president taught that his Trump, I call them Trumpets, people with small minds that follow him. But they want to believe that everything's okay, and he has been able to do that, right? And David K. Johnson said that somehow or another he managed to do this. But he point blank said it's just like the flu. People die from the flu. We have, 200,000 deaths of the flu. So big deal. The risk of the amount of people, this is what he would say. Please don't cut and paste this of me saying this, please. But the president says that the risk of people dying versus the amount of money that they would lose, our economy loses, is not worth it. That's what he kept saying. And so people believe that because they believe that, well, 250,000 people die from smoking. Well, then why don't we cut cigarettes out of our society? I agree with that one. It's pretty dang stupid that, and insurance shouldn't cover them if they're going to smoke. People who quit smoking, that's a different story. If you quit smoking, fine. But their attitude is people got to die anyway, right? People are going to die anyway. The amount of deaths that occur from this is not worth the risk of losing the economy. And that was their attitude. That's still the people's attitude, because most of the people that are talking like that haven't lost anybody. And it's interesting to me, the minute I hear somebody say, oh, my brother or my sister's on a ventilator, or my mom or my friend, the minute you hear that, their tune changes. It's just a totally different story.
What they don't realize is that a nation's strength, its economic or any kind of strength, depends also on the demographic of the people involved.
Yeah, true.
If you have your most productive people dying, and you're also, there are two things that are happening. Children whom we thought were not being affected are getting that strange variant of the disease, which is extremely deadly. And, they're getting horrible rashes, and sometimes they even succumb to it. And the second thing that's happening is even the younger people are getting it. So if the productive people in a population die, you can say any kind of slogans, you can print any kinds of decals on your cars or on your baseball caps. You're not going to make America great again.
No, you're not.
You're killing the most productive Americans, that's all. What is going to happen is you're going to be killing the most productive Americans. And that is tragic.
Well, here's the thing. The majority of the people, they still believe that it's only killing the elderly, and they don't have a problem with that, which I do, because the elderly served our country. I don't want somebody to wish me dead because they want their money in their pocket. So again, it's all about the civil liberties. But what people haven't done, and I would love to have David K. Johnson back on just to talk about just this, but there is a law that says we do not have any civil right liberties to even protest when there is a virus pandemic. There is a law written to this, and I would love to get him on to talk more about why that's important. If we were at war and they wanted to, demand people join the military, they can do that. They can do eminent domain anytime they want. It's just when they want to. The problem is the president had an idealism that he didn't want to lose his popularity over looking stupid because nobody got sick and died. So I think he had in his mind, he was going to come in and react when there was a certain number. And what he forgot was he was looking at, because I heard him give this speech. I put a lockdown exactly when there were 1,600 people reported. But what he didn't look at was the report he was looking at was 10 days way late. It was today's. And so he really, on the day he looked at 1,600, there was probably 16,000. And he didn't calculate that. His staff wasn't smart enough to see that. Nobody, not the WHO, not the CDC, nobody was smart. We were talking about it. I don't know if you remember, but we started talking about it. Yeah. People don't look at that number because it's going to be, and Nick and I, we already started doing the calculation that we're probably already 20,000. We're probably already.
And Kim, we in fact talk about the airport. We talk about how the lineup in Miami and how no one is listening to US, and Trump is doing whatever he wants to do. And he still wants to work out the economy. And I still remember in the initial COVID thing, Trump was doing a lot of, talks in terms of how we can build up the economy and things like that. And there's no discussion about COVID. And they think that it's a Chinese flu, it will happen just like that. And the day it started hitting New York, they were not in control. And then that's what happening till now.
So I'm going to pull that video, Kuma, because it was so impactful. It was like watching J.F. Kennedy speak, or Bush when he did the speech on 9/11 that we will rebuild. It gave you goosebumps because he said, the economics can die. We can fix that. You can lose all of your money in your bank account. We can help you recover that. But we cannot bring a dead person back. What don't you understand about this? And that woman just wouldn't stop. She was a reporter, and she goes, people are committing suicides. He goes, actually, we could probably fix that. Get it, but there are some things you can't fix, but we can fix people's income situation. We can prevent you from losing your home. We already put in a law that people will not lose their home in this time. That law was put in place like the first week we went into lockdown, thanks to a female senator, I want to say. But the thing is that we can't bring back dead people. What about their families? Who's taking care of them? Right? Who's taking care of them? A lot of these and the young people that are dying from strokes. The young people should not be dying from strokes. So, and then you have this report, well, people are going to die anyway. So it's just, but I have a problem with the people who say we're making, the numbers are being made up. Actually, they're far under. They're very far under, because they can only report a COVID death if they were tested positive. That's it.
And also, do you remember what David said the other day, that a lot of people are dying and they can't test them because of the lack of testing, and also they don't want to create such kind of a panic. But those deaths could be possibly COVID deaths, but no one knows.
Well, and it's like I said,
yeah. Sorry.
No, go ahead, Rakesh. When somebody else goes. Go.
From what I'm hearing from India, a lot of the migrant labor have already returned to the villages, and you are going to see an absolute carnage out there because they have no facilities whatsoever. And what will happen is that because the chief ministers have made it an ego issue, it will simply be brushed under the carpet. They will not even be reported as COVID cases. But the virus is going to be there. Even dead bodies are infectious. So I don't know what to say.
I agree.
That's going on. That is certainly going on, and that's happening across India. But we are still.
Also discovered that it's in the feces. See, they kept saying it's not in the feces. It's not in our.
In Hong Kong, right from the beginning, they said it's in the feces. Watch it.
Well, and here's what bothered me from the very beginning. They were playing on words, right? They were playing on words, and they go, "It's not airborne." So immediately everybody goes, "I'm safe," but it was aerosol. But they knew what they were doing. They knew what the hell is aerosol? It's airborne. I brought this up in the very beginning. I read the article. It said aerosol. But they were saying, but it's not airborne. And my family would get in my face, not my immediate family, but my outside family. But they say it's not airborne, Kim. You don't know anything. And I go, I know how to read a white paper. That's what I do for a living for many, many years. I wrote them. And I know how to read a white paper. It says aerosol. I know what the heck aerosol means. But they intentionally played on those words. So they can legally get away from not saying that it can transmit by air. But like Ankit said yesterday, first week it was, it's not airborne, you're safe, And then it was,
So it's surprising how no one knows, basically. No one knows, and no one wants to follow. And also, I think there's one more thing I would like to say. No one wants to take accountability what's going on. Whether it's the health organizations, whether it's someone else or someone, because no one wants to do it. Because a person who will see accountable, they will have all those things.
I'll bring you
we don't know, we just want ourselves safe. That's it.
I'll bring you a pin that we had one time because I was in diagnostics and we were converting over to fiber technology, and all of the companies didn't want to take the blame for them not transmitting enough data, right? That they had failure rates. So we invented the piece of equipment that could go between all of them and capture who was really making the mistake. But at every standards meeting, it was this. It's not me. It's and so we had a pin made of people pointing fingers at each other because it was like, no, it's got to be somebody. But let me play this video if you guys don't mind. Let me see if it came up. This video just impacted me more than anything this whole time. If it comes up, I don't know if it's going to come up. They might have taken it down. You know, there's so much political crap between Cuomo and Trump that every time Cuomo says something, Trump somehow or another gets it pulled down. Let's see.
I think Cuomo might be looking for 2024.
I would vote for him now, to be honest with you. There's nobody worthy of voting for. I like Biden. Don't get me wrong. I would support Biden in a lot of things because he's the only one who ever wrote a law to protect victims of domestic violence, and he's made every president sign it. So,
I think that during this pandemic around the world, we need leaders who have that experience at a global platform, because someone who is new come on this party right now, it's difficult for them to handle. I think Biden has that experience, but maybe someone new, if you tell him to be aligned and manage the world in this current situation, I think that would be a little difficult. But I mean, there are a lot of strong people who would like to, go and sit on that chair and then manage the world.
And raising signs, and they're saying.
So here we go, guys. You got to see this. This just totally blew my mind. And I know we got a doctor on, but I want to share this before the the doctor can come and join us. But I'm going to share this. Let's see if I can pull this up. Facebook. Here we go. Here we go.
And that they don't have time to wait for all of this testing, and they need to get back to work in order to feed their families. Their savings is running out. They don't have another week. They're not getting answers. So their point is the cure can't be worse than the illness itself. Yeah. What is your response to that?
The illness is death. What is worse than death?
What if somebody commits suicide because they can't pay their bills?
Yeah, but the illnesses may be my death as opposed to your death. They said the cure is worse than the illness. The illness is death. How can the cure be worse than the illness if the illness is potential death?
What if the economy failing
worse than death
equals death? Because of mental illness, the people stuck at home.
No, it doesn't. It doesn't equal death. Economic hardship, yes, very bad, not death. Emotional stress from being locked in a house, very bad, not death. Domestic violence on the increase, very bad, not death. And not death of someone else. It's not about me, it's about we. Get your head around the we concept. So it's not all about you. And think about it as if it was your family that might get infected, right? And nothing comes before the public health risk of somebody else's life. And that's where we are.
But they're also saying, if you can't afford to pay me unemployment or your system is not set up,
you will be paid.
But they can't wait for the money. They can't wait for the money. They're out of money.
Yeah, we're talking about a couple of days lag on the unemployment insurance, and they will get the check from the date of unemployment. It does not cost them an extra penny. Now, they can say unemployment insurance isn't enough. I get it. Even with the $600 check and the $1,200 check and the unemployment insurance benefit is not enough. I understand the economic hardship. We all feel it. The question is, what do you do about it? And do you put public health at risk? And do you drive up the number of deaths for it? Because you have no idea how to reopen now.
They're saying that, is there a fundamental right to work if the government can't get me the money when I need it? Is there a fundamental right
to go to
work?
work? Go take a job as an essential worker. Do it tomorrow. Right? You're working.
I am.
You're an essential worker. So go take a job as an essential worker.
But the people aren't hiring because of the
No, there are people hiring. You can get a job as an essential worker. So now you can go to work and you can be an essential worker and you're not going to kill anyone.
Wow.
So that you know,
Donald Trump,
I just got.
Yeah.
I agree with him. You can
Yeah.
do all these things. You can't fix death. Get away from me. Get back to we. I mean,
True.
what is wrong with people? And Raja, Dr. Gupta, pain
How
specialist.
you doing?
I'm doing great. My hero are pain specialists. I love pain specialists, right? I always hated that term, no pain, no gain. Quite honestly, I don't want any pain. So how are you doing in India tonight?
We're doing very well. We are keeping up with good health and saving our environment, saving the people around us. So we are trying to follow the policy of we, like he rightly said. So we are still following the lockdown policies strictly. So doing good.
Awesome. I'm glad to hear that. I'm glad to hear too that India took the initiative to say 2 more weeks. And I don't know if you've ever watched the movie 93 Days, but it was to me
Fantastic.
it was a true story. It is, isn't it? Right. But to me, it is the true way to stop an epidemic of any kind is the way that they approached it. But also the mindset of it, it's really going to take 90 days. That's what I kept saying in the very beginning. 2 weeks, 3 weeks, 1 month is not going to get this. We need a full season to heal, a full season to get a grip around what's happening, understand it before we even go back. And one of the doctors even wrote, why can't we wait until we see 0 new infections? Wait it out 1 week, 0 new infections. Then we start with ground zero, right? And then gradually get back. But we're too eager. Do you feel like the mental state of minds are going crazy, Dr. Gupta?
Yeah, definitely. And it's like when you try to fool a kid, if the government comes and says that you're locked down for 90 days, it's impossible for people to stay at home and they'll go crazy. So it's like 2 weeks, you keep reassuring and you keep pulling on. So this is the trick they're doing. So eventually it will extend till 90 days. So the day it started, we expected it to go on till June. And that's where we are heading to. So I think they're just playing with the psychology of people and keeping us calm down with the hope that after 14 days, we'll be back to normal.
I think, do you think some people go, well, you've told me 2 weeks for too many times, like that movie Money Pit, and he goes, 2 weeks, 2 weeks, 2 weeks, you're sounding like a bird. Do you think people are getting tired of hearing 2 more weeks?
I'll be very honest, people are definitely getting tired, but our leadership in India, Mr. Modi, our Prime Minister, is very, very smart and very down to earth and connected by the general public. So the way he communicates himself, the way he comes out with the ideas and the policies, general public relate. And he was a common man. He was a tea seller, so he can understand the mentality of general public, and people do appreciate him and do listen to him. There are few people who don't listen to anyone, so they do come out on roads and they don't follow the rules, and that's why we are here having huge numbers.
I think eventually we're going to have to come down to some law enforcement for people who can't abide by the rules. Like, I have issues with people coming to work sick, and that has been the biggest problem for years. And now if somebody comes to work sick, they cannot just make me sick, but they could kill me, as far as I'm concerned, But what is your opinion? I mean, as a doctor, what is your opinion on a lot of testing, maybe even daily testing for early detection?
See, as long as you have the backup and you have the infrastructure to do that, you have the kits, there is no harm in doing it. But again, it comes down to shortage of supply and faulty kits. So because people are feeding in with a lot of kits just to earn good money, there are a lot of faulty kits coming in. So there are lots of false positive tests also, or false negative for that matter. Like few patients were tested negative on a rapid testing kit, which came out to be positive on RT-PCR. So like, what are we doing? So we are creating more of confusion and distrust on the medical facility as a whole. So
Right.
I think in that we should have strict rules and regulation, and we should not rush for testing, and we should have proper certified testing kits, and
I
that's the
agree.
way to go in. Yeah.
Certification kits, I think too. So I think that they should be like staged. If you're getting tested and you do find that you're tested positive, then you take the next stage testing just to confirm positive, right? So I think, but certified kits, I think, I'm trying to understand how are so many faulty kits coming out. I mean, there's certainly got to be a reagent. It's a reagent, right? A chemical that it's a little bottle. Ankit and I have seen the kits, and but all of this chemical has got to come from the same vat somewhere, or somebody mixes up the same chemical. I mean, why would somebody generate faulty kits?
See, I don't know. There are people who have the mindset of earning money. Moreover, there could be a strict temperature control, which probably we are not able to do for the reagent.
That's good.
And in different countries, we have high temperatures. I don't know how the kits are lying, what facilities they are in. So we really don't know how and what's going on. But we are sure that the kits are not 100% right. So there are faulty kits coming in.
Wow, that's well. Hopefully, we'll put an end to that. But let's talk about some other positive things because you are a pain specialist, and this is your area of practice. And this is a doctor that I just like really am thankful for because I live in chronic pain with a disease. But what are some of the changes that you've seen on how you have to practice with your patients today?
So the biggest change which has come into medical practice is telemedicine, teleconsult. So which is going to live with us like COVID is going to. So this is something a new boom in the field of medicine, and we as doctors are enjoying it with its limitations also, and patients are getting familiar to it. So it's very convenient for the patients, and it's very convenient for doctors as well. And so we are enjoying it. And follow up on telemedicine is easier. It is difficult to see new patients on telemedicine. So this is how things are going. This is the new things which we are doing.
Are you finding it though, even though it's easier in some ways, maybe a challenge because you can't physically see the patient?
Yeah, that's what I said, that new patients are difficult to be seen on telemedicine. But yeah, follow-up patients are patients who are cancer pain patients who are on regular doses of opioids. They just need a refill. So it's easier for them. We send they consult the prescription directly to the pharmacy, and they can collect the medications from there. So it becomes easier for them.
All right. And in my case, unfortunately, because of our country, I cannot get my refill on any opioids without physically seeing the doctor. So I still have to physically, even though I've had a chronic disease since 1998. And I don't abuse them. I use them just when needed, but that can be a challenge. Is it, in your country? Also, like physical therapy is very important to me for pain. How are you handling that with some of your patients?
So as of now, we are just focusing on asking them to exercise on their own. We are forwarding them videos and charts, exercise charts, which they can copy and follow, because we are not advising them to go to a physiotherapist or a chiropractor for that matter and do live sessions. Or I can even put them in touch with physiotherapists who can do again tele consult live sessions on video. So this is how they're trying to manage.
It's so odd to me because I'm so used to that physical meetings. I think there's something to it mentally for me. The telemedicine has just been very difficult for me. I do it because I need it. One of the things I found with pain is I went to a pain psychologist for a while. It wasn't a full term, but it helped me understand me, my pain thresholds. um, I don't know if that's something that you practice, but it didn't mean I was crazy. It didn't mean anything other than I just didn't panic, right? And I learned to deal with it. Rest is very important in this time, isn't it?
So here in India, I was trained from McGill, Canada. So I learned the technique of interdisciplinary pain clinics. So we used to have a pain specialist with a psychologist on board. Together, we do an initial consult for new patients. And if the psychologist feels the need for the patient to be seen by him or her, so they take a different appointment and see a psychologist as well. So I'm trying to follow the same culture here in India. So we do involve psychologists and if needed a psychiatrist later on if it's not managed. But a lot of patients are very well managed by psychologists, and especially the cognitive behavioral therapies are doing wonders for chronic pain patients.
I found a huge difference. My whole way of dealing with pain and everything just changed completely. My ability to sleep better. You know, I have my days, right? We all have, but we all have bad days. This is what I finally, we all have bad days. But I found that I could put myself to sleep better, sleep. I just found a completely different way of accepting the pain, as opposed to fighting it and being depressed with it. So I think that I'm glad to hear that you do the both. I think they're both are very, very important. And like you said, not everybody needs it, right? You banged up your knee really bad, you're in pain, you get your surgery, you heal. You might not need a pain psychiatrist, but the chronic ones. I have a question, this isn't to be a bad question, but we have an opioid overdose problem in our country. Is that a problem in your country?
See, in India, first of all, we have very restricted permission for opioids. Like in states and in Canada, we have oxycodones and hydromorphones and oxycontins and everything available. Even the methadones are easily available. In India, we are mostly familiar with or available with fentanyl and morphine. So are not much. And moreover, in India, we are not using opioids for chronic pain patients. We are mostly using opioids for cancer pain patients.
Oh, wow.
Unlike states, where we are using it for chronic pain patients as well. So if you are using opioids for cancer pain patients, the chances of addiction and overdosages are very less. But in chronic pain patients, the chances of addiction and overdoses are very high. So that's why we are not dealing with a lot of overdosages, and it's not an epidemic in our country as such.
That's an interesting mindset. I don't know that anyone's ever talked about that here, and because it's such a huge problem, and we are such a bad reactive country rather than proactive. But that's an interesting way of looking at it. To separate the two like that. That's very, very interesting. I would love to see that conversation be managed here as well. So, what are some of the things that telepathic? I guess do they call it
telemedicine?
Okay. Telemedicine. What are some of the things that your patients are they happy with this as well?
See, it's new for all of us. So when we started, it was very unusual. It was like explaining the same thing 4 or 5 times and recording the whole session. Then, because at times patients tend to not understand what I'm saying and tends to say that, and then sending the prescription across scanned version. So people are not familiar with. They don't have easy access to printers here in India. Not everybody has a printer set up at home, and I'm talking about people who come from rural places. So in metros and in bigger cities like New Delhi, we have access to printers everywhere, but not everybody has access to printers in the rural villages. So people who are coming from those parts it's very difficult for them to understand the concept of how can you see me on phone. So that's very interesting. But gradually we are learning, we are improving, and we are able to convince them better. They are a little more reluctant in paying their fees for teleconsult, like paying so much of money just for 10-15 minutes. So it's a little unusual for patients. But again, the whole concept is going on, and we are improving on that. Everybody is. We are learning.
Well,
yeah. So when we talk about pain, how important or how what is the role of willpower of each and every individual to bear that pain? Because a lot of times, especially in the cancer patients, they have a lot of pains, and if you inject a lot of medication, still they have that pain coming over now and then. So how important is the willpower in playing the role to maintaining the pain in the body?
See, pain is a very subjective feeling, and what you perceive as pain, I might not perceive it as pain. So it is the brain that perceives pain. So it's like training the brain. So people who have strong willpower and strong will to be fine and strong will to be okay, they definitely perceive pain lesser than people who don't. And this is why a role of a psychologist come into play. This is what he or she trains the brain. Distraction therapies like listening to music, distracting, going for shopping. So it eases you down, calling guests on, doing what you like to do. So you are trying to distract your brain. So your brain doesn't focus all the time on pain. So this is how these are adjuvant therapies, which is helping us in controlling chronic pain patients. And in cancer pain also it works wonderfully. But again, not per se, not alone as a therapy. You have to combine it with medications and physical therapies and psychological support. So it is a multidisciplinary kind of an approach.
No, I think you're right there too. You just, it is subjective. Each person is different. Thresholds are different. I will tell you this. I'll be doing fine for a while because of the treatments I get. What I have is a considered a tumor or a cyst in the spine, but and I really work hard at not taking the opioids unless I have to. Right? It's just a promise I made myself. But when the treatments wear off, I almost feel like the pain is worse because I haven't had it for so long that it's very like, oh my God. It's like getting hit with a baseball bat, right? It seems worse than it was previous. And I go, are the shots really worth it? Are my treatments really worth it? Because when it wears off, it hurts really, really bad. So I think you're right that, it is subjective and different for everyone. What are
do you also see a difference when a person is doing a lot of work, he's busy in the work, they have less pain as compared to a person who is sitting idle and just thinking about the disease?
Ankit, I always say pain is like a mosquito. Have you ever noticed mosquitoes bite at night? Why don't they bite in the daytime? Because when you're lying down in a bed and you have nothing else to do, then you feel mosquitoes biting you. Similarly, pain. When you're busy and you are distracted, you don't feel your pain. But once you go back home or to people you are not comfortable with or you don't like to be with, there are a lot of factors. So you definitely feel more pain.
It's all about the mind game then, I think.
Yeah, it's all about training the mind.
You're right too, because everybody asks me, how are you getting on and working all day long? But how do you live with what you have? Even my doctors for years could not understand but I go to work every day. I just don't, I don't think when I'm at work, I don't think about it. You're right. I'm there and I stay busy, but when I get bored, then I start going, oh, I don't feel so good. I want to curl into a bed, but yeah, no, you're right. It's definitely having something to do, not thinking about myself, but thinking about everything else is definitely, I will say this, I'm very, very tired at the end of the day. And when I do stop, I go, oh, I hurt. And everybody goes, why do you work so much? But it didn't feel bad while I was working. I don't move a lot either. So that, and I know when to slow down, and Kit can see it. I know kind of when I have to pull back a little bit, but I think you have to have something mentally to do. But how do you convince somebody who, and I mean, I know how I convince myself because I'm afraid I'll never walk again. But how do you convince people? That's got to be your toughest job, is convincing people. Yes, you live in pain. Yes, it might be like this the rest of you. How do you convince them to get out there and do it? Just do something.
See, it's again a trick. It's again like everybody's doing about COVID. 2 weeks, then 2 weeks, then 2 weeks. Okay, so it's the same policy. It's like 15 minutes walk out of home and 15 minutes back. So just walk for 30 minutes in a day. So if I tell you to do that, 15 minutes is like nothing. You're like, okay, I can walk 15 minutes out, and then if you go out, you will have to come back to your house, right? So you will walk 15 minutes back. So 30 minutes doesn't look much. If I ask you to walk for 2 hours a day, you will never walk.
No, you're right. I have this book called here. This is my favorite book. This is how when I get off track, I get back on track because there's no excuses. 8 minutes a day, right? There is no excuses for 8 minutes. And all it is stretching and running in place. Run in place for a minute and stretch. After you do this a while, you go, oh, I can do more. Like you said, I can do more. I can do more. But it's my guilty book. Every time I get off track, I go, I can do 8 minutes. I can do that. So you're right. It's a mental thing. That explains.
That explains 2 weeks lockdown.
Yes.
I said that explains 2 weeks lockdown.
That
every
does
2 weeks.
It does. I just think, people are going to get tired of hearing that. When I was mentally prepared that I might not ever walk again, but that I had to lay still, and they told me I was going to be incapacitated. I'm going to tell you what, I had no idea what that meant. I mean, in my mind, I thought, just lay, but I couldn't move my arms or anything for 3 months. Not 30 days, 60 days, 3 months. And you think you can mentally handle it, but I want to tell you what, it was very, very hard. It was very, very hard. But it gave me something to look forward to, because I said, well, on the 90th day, by God, I'm going to be up walking, right? It wasn't that easy either, folks, because what happens is your muscles deteriorate. So while you're inside, it doesn't mean you go inside and you just stay inside. Get outside a little bit, get the sunshine. Like he was saying, go out and walk for 15 minutes. That's something I've been trying to convince my son to do, because he's up in New York, but he's not in the city, thank God. But he just moved up there. But I'm like, just 15 minutes in the sun every day. Get outside, do your exercises inside. If you're not comfortable, people who go to the gym, find like that 8 minutes a day. Guilt yourself into doing 8 minutes a day. Self-challenging, that's something else. We're going to start a physical fitness channel, but maybe even somebody like you, and you can just, like you're doing today, just do it. There's nothing stopping you. This is what I tell people. You're at home. That 1 hour driving back and forth to work, you're not doing that now. Work out. Put an hour into working out. It's instead, in my life, I ended up working extra hours, right? I'm on TV more than I've ever been. Ankit and I counted. We've done we're at 250 shows now.
More than that.
Yeah, because 1 hour shows constitute as one episode. And so we've done over 250 episodes.
That is also within 60 days.
Within 60 days. I don't know of anyone who's done that. I really don't. Even Nick. Nick is like, I cannot. Because we are exhausted after an 8-hour day on set. We are just wore down. And to do as many as we've done. So, it's inspiring to me, because I'm like, I did it. Yay, we did it, right? And that's what, you got to have those reward moments, right? With your patients. Your patients have to be rewarded. Rakesh, do you live in pain?
Yeah.
Yes.
Shoulder pain and things like that. And
I was thinking about a case of a lady in the UK who didn't feel pain at all. And they discovered it when she had a baby.
oh yeah.
Oh.
and the doctor said, push, and she was doing all that had to be done, but she didn't feel pain at all. And I was thinking about how pain is one of our warning systems. If we look at a body as a defense system, it's a kind of our warning system that, hey, don't push me. Yeah, that kind of thing. So from a point of the other thing you're talking about, the opioids, in New Zealand, there's a strong pro-opioid movement. I don't know that much because I've left India now almost 25 years. So although I do visit off and on, I don't know much about what's happening in India. But in New Zealand, there's a strong I think it's no longer a crime in New Zealand to have CBD, you call it, I think.
Cannabinoid. Cannabis.
CBD. So it's not a crime in New Zealand anymore. I think if you deal in it, it's a crime, but otherwise to just possess it is not a crime. And in terms of COVID, I keep thinking of that lovely lady who came on show from Georgia, with Tylenol and how she handled it. I mean, this was just wonderful. I don't know much about Hong Kong and how, but I don't think that we're doing any special treatment for pain because of COVID. We have, well, I sort of hurt my back. They said that I need to wear some kind of a thing which to wrap around my torso, and that was it. They did give me some very powerful painkillers, and I refused to take it. I said I'd rather just have a support because I believe in the early warning system. I don't know whether I'm a masochist or what.
You made a valid point there, and I lectured this in court one day because I was trying to get disability because of my disease, and was told that I should never work again. That's what they told me. I just really shouldn't work because of how dangerous the disease is. It's not contagious, but to me. I told them, I said, I can live on drugs, but I'm not going to have that warning of when to stop. And I might re-injure myself because I'm thinking I'm fine because I've done that before. I'm fine. I'm okay. I can go do this. And so I did something and I fell and I broke my arm because I was doing something I really shouldn't have been doing. I was doing something I shouldn't have been doing because I was like, woohoo, I feel great. I feel fine. I'm super mom. I don't have a disease that's going to kill me if I, and I fell and I broke my arm. And my doctor said, well, what were you doing? And I go, I was feeling great. And he told me, he goes, just because you feel great doesn't mean you can go out and do these things. Your body can't do, you're physically, they told me I was physically great for the problems I have. But threshold is important. What do you think, Dr. Gupta? Pain threshold is important.
Yeah, for sure. For sure, pain threshold is the major thing. And like we say, diseases like fibromyalgia, there is a lot of decreased pain threshold. So even the touch is being perceived as pain by the body. So that's why such patients are in a lot of pain all day long. So yeah, pain threshold is the key. So that's what it's like training the brain, raising the bar of pain threshold back to normal. So that's what as pain specialists, we're trying to do.
Yeah, so there's that.
I have a question from a viewer, and he wants to know that how a mental pain is different from a physical pain.
How to tell the difference? Mental?
How a mental pain, so people have mentally they're disturbed, so they are having some pain inside their body, which they are not sure where it is, and it's different from a physical pain. I'm not sure, but that's what they want to see.
I can only explain that mental pain is probably what we call as stress.
Okay.
That's called the mental pain. And physical pain is like bodily pain because of arthritis, aging, overuse of your body. So, yes, stress can increase the physical pain, and physical pain can increase the stress again. So, it's a vicious cycle. So, both go hand in hand. So, if you have a physical pain, you can have stress, and if you have stress, it can lead to more of physical pain.
So yeah, and I found that if I think I'm sleeping sometimes, but my doctors told me that you think you're sleeping, but your body's not really resting. You're still having, and so occasionally I've had to take things to help me. Even though I felt like I was sleeping good, I kept going, I just don't feel rested. They go, that's because your body's fighting the pain while you're sleeping. So your body's never resting, and that's why it doesn't heal. And I think that's why so many people suffer and struggle so much. And so when I finally agreed to take the medications at night so that my body could rest, I actually started to heal. I heal a lot faster. So you can think you're sleeping, but your body's not. And I found that to be very impactful in therapy to understand that. You know, and you know, the thing to do is get doctors to come in and help, right? Good doctors, go see your pain doctor, Dr. Gupta. That's what they're there for. That's your practice. You know, don't be afraid to go. And even if you think it's all in your mind, that's when you really need to go see somebody, right? Make sure it's not just in your mind. I had my doctor one time say, no, Kim, it's not in your mind. It's exactly where that pain is. I tested it. You got pain. So I'm like, okay. So that's important. So you studied in Canada as well, or you practice in Canada?
I did practice in Canada for a couple of years. I was trained from McGill University, Montreal. I was in Montreal for a couple of years. I did work in US also for 5-6 months. I was doing my clerkship internship there at Cleveland Clinic, Ohio. So I've been exposed to the Western world. So that's when I started thought of becoming a pain physician. So I was an anesthesiologist who super specialized into pain physician.
Yeah, that's a good transition to understand all of the anesthesia that goes into the body, the drugs, how they react in your body. I mean, that's a good transition. What do you find? Do you ever find some good alternative means of deferring pain?
Sorry, good alternatives to?
Yeah, do you have any good alternative practices that you like to use for deferring pain?
I think music is the best therapy.
I love
Trust
it.
me, music is the best therapy to defer pain. Apart from that, meditation, yoga, they are very, very good therapies to distract pain.
Now, those are probably the two. I agree with you. And they don't cost me anything, do they?
They don't cost you anything.
It's free. So, but anyway, we have another doctor here, Dr. Roll. Welcome again.
Hello.
Hello.
Yes.
And how are things in where you're at today?
Things are good, as they are always.
That's always good. You know, the doctors are always happy on our show, aren't they, Ankit?
Yeah, they're always happy. They are always motivated, and they know how to manage these kind of situations. I think they are superheroes.
They are all very superheroes because even if they're not dealing with COVID in itself, they still have to treat patients. They still have to be with people, even though they're using the telephone more. You still eventually have to interact, and
Yeah.
so all the doctors are definitely heroes.
And I
But
think the best part is they're always ready because they know that in their profession they have to be ready 24/7. So I think they're always ready to take the call, and that is the best part because if you call me at any time, it might be difficult. I will just see how I can dodge it, but I mean they are always ready to take those calls. So I think
well, no,
salute to them.
Thank you, Ankit.
Thank you.
yeah, salute you guys because I think that you definitely serve us. But the thing is you guys have such a great I feel like I missed a job opportunity by not going into medicine. My mom kept telling me, go into medicine. And I'm like, oh, that's just so much studying.
And with medicine came, I have one more question from a viewer. And so in India, people generally, whenever they have a pain, they generally take a paracetamol, as Dr. Rajat aware about. So how good, or is it good to have the daily dose of paracetamol? Or, I mean, does that impact your body at some point of time? Because with a small headache, they start taking paracetamol, and also whenever there's a body ache and things like that, they just take a paracetamol medicine. What do you think, Dr. Rajat?
See, paracetamol is, as a pain physicians, we call it as a candy. Okay, this is the safest medication in the world.
Okay.
Anybody can take paracetamol, but what is important is if you take more than 4 grams a day, that is more than 4,000 milligrams a day, you tend to damage your liver. So you have to be cautious. Secondly, it is very important that you don't routinely take paracetamol, especially during this COVID period, because if you have symptoms, that will be masked if you take paracetamol. So if you are having body ache or malaise or fever, because if you take up paracetamol and board a flight and you get down at India or any other country, you will not be screened. They will not show you fever on thermal scanner. That's what people have done to skip scanning. So
that's
because
interesting. Wow.
Because paracetamol is antipyretic medication. It's used for fever also and for mild analgesia. So though it's safe, but it also tends to mask symptoms. So you should not take it during an epidemic. Like right now, if you are taking paracetamol daily, it's in the need that you go to a doctor and show, because that's not normal.
So can you
otherwise, as a routine,
spell it out on our banner so people know what it is? Can you type it up so that we just let people know that it's not a good thing to be taking during a pandemic situation? That
I would say avoid any medication during epidemics without a consult.
Oh, without your absolutely.
For that matter, any medication.
So Dr. Rajat, in case of some pain, maybe, or a severe pain, what is the one medicine a person can take if he's not able to reach out to a doctor? I'm not talking about pandemic. Generally,
you can definitely take paracetamol. You can definitely take ibuprofen. They are safe medications. Ibuprofen you can take, but again, it depends how frequently you are taking it. Like ibuprofen tends to damage kidneys, tends to give you gastric ulcers, or if you have high blood pressure, tends to increase your blood pressure. So you need to know your medical history. You just cannot take it. There is no simple medication the simplest medication which can be taken as a routine is paracetamol.
Okay.
Which anybody can take, even a kidney patient, even a liver patient, one tablet, but he cannot keep taking it every day.
No, I agree. That's very, very.
Also, there's one more medicine which is close to paracetamol and which is also very popularly used in India, which is known as Combiflam, which has some paracetamol with some other salt. Is that also?
So Combiflam has paracetamol plus ibuprofen.
Okay.
Now it's not safe because you can take Combiflam once in a while, like 1 in a week or 1 in 10 days, but you can't take Combiflam every day because Combiflam has ibuprofen also.
Okay.
So it can definitely affect and damage you and damage your kidneys.
Okay.
But plain paracetamol, 650 or 500 milligrams as per the age and the weight of the patient can be taken as a simple analgesic. But if you require it every day, then you need to show to a doctor. But do not take any medication without a consult, especially during pandemics.
Okay. And we have one more question from Mr. Rajkumar Jain from Mumbai, and he always used to join us on our show. He wants to know about Dolo 650.
Dolo 650 is paracetamol 650. So it is the same thing. That can be taken.
Okay. Great.
Well, this is good information. I would have not thought about some of these problems with the medications, and I should have. I mean, this is something good to know, especially if we're going to be doing some talks with pharmaceutical companies to understand these things. But we definitely don't want to be masking our symptoms during this time frame. So absolutely. I'll tell you one thing I have found is just even though I've been trying to get exercise in every day, I tend to be fatigued, and I don't know that I'm stressed out over COVID. Maybe I am, because I live out in the country anyway, so I'm kind of used. But I'm used. But no, actually, it's not true. I'm used to traveling 85% of the time. So this is kind of bizarre for me to be home, but I'm not allowing myself to be locked in. But I find myself fatigued. Is that a common problem?
See, the reason for fatigue is lack of sleep, first of all, and lack of sound sleep. Like you say, you are sleeping, but your body is not sleeping. So it's not the body; it's the mind that is not sleeping.
Okay.
So there's a need to have a sound sleep. Secondly, exercise is very important. Physical exercises is very, very important. If you don't use your muscles, you will tend to feel fatigue. Thirdly, diet is very important. So you should have a good protein diet and lot of water,
A lot of
liquid.
liquids. I think I've kind of been failing on that lately. I'm not drinking as much. Ankit and I used to compete, but we stopped. So maybe I need to start doing that because I notice my cups are still full at the end of the show. I try to bring in a bunch of different kinds of hydration. I bring in lemon mixed with water, tea, just different, nothing soda. Ankit and I have a rule, no soda. Otherwise, we'd be doing belching contests. But I appreciate your tips. Are there some things you would like to share with the viewers while you're here?
Sorry, that was for me. I didn't hear.
Yes, I'm sorry, Dr. Gupta. I was just wondering if there's something that you would like to share with the viewers about what they can be doing during this time frame, just to let them know they're not alone.
Just be positive. We'll fight it out. We'll start living with COVID, and it's going to be like a normal influenza or a normal viruses. Everybody will get infected. We'll develop the herd immunity, and we'll start living with it. So it's going to be a part of our life. Nothing will stop. It's just a phase, and as doctors strongly advise not to take medications without any consult. And this is a beautiful channel running on, so you have everything on board. I can see a lot of entertainment as well as education, so it's a good mixture of everything. So keep logging in, and you'll get the best.
Thank you. And I want people to know that if you're feeling and having problems and can't figure it out or need some help, contact us at GoLive@IBM.TV. Ankit and I are really, really good at helping people find solutions. We've even helped doctors find PPE equipment. They weren't able to get PPE equipment, so we've kind of connected some dots for them. But you don't have to be a doctor to call us for help. If you're a person out there with chronic pain, reach out to us and we'll connect you with Dr. Gupta, and you can ask him direct questions. So, thank you so much. So,
and I think to reach if our viewers would like to reach out to Dr. Gupta, so they have a website called orlinclinic.com.
There you
and
go.
they can reach out to Dr. Rajat Gupta at orlinclinic.com. And I think Dr. Gupta is ready to serve people around the world. So let's stay blessed and hope everything will be fine as soon as we can.
That's right.
Thank you, Dr. Gupta, for joining us today.
That's right.
Take care. And also, before you go, we have seen a different look of yours from what we had in the past. What is the change makeover?
Yeah, what is the change?
So I have not cut my hair, and I've colored my hair.
Okay.
You did your own.
So trying to look different. So we need to be motivated.
I love it. You're looking great. Ankit's been doing his own hair, and I like it. I like it. Self barbers. I love it. Colored your hair. I haven't done anything to mine. I've just let mine keep growing because I'm not going to go see the beautician, and I'm not coloring it, so it's not blonde anymore. So I get it. It's different, but
Thank you.
It looks good. You look great. I love it.
Ankit, I'll take care.
Patient's age is 85. I know case. What is hemiplegia?
So this question is for Dr. Rajat. I mean, before you
Oh,
go,
Dr. Kumar. Okay.
Yeah.
Another doctor. Okay.
So L4, L5 is fractured and having pain in the leg continuously. Can't take much painkillers. Kindly advise pain medication. Now, the thing is that this patient needs to be seen in person. I can definitely help the person. I can definitely help the patient because the heart is working 30%. I cannot just prescribe medication over phone.
Right.
So definitely would like to examine the patient and see all the reports. But definitely I can help with pain. I have painkillers which are safe in such patients also.
so I think we can request Mr. Rajkumar Jain to get in touch with Dr. Rajat and
Yeah.
then.
Yeah.
Absolutely. We'll connect the dots. You know, this is
Yeah.
what I love about this show is we're about the solutions, right? We're not, you can complain, but we're about finding the solutions and talking through it. And we want to help find the solutions for people who are out there suffering and maybe can't get to your doctor. You know, again, we're not like 100% everything. We always say consult your doctor, but we've got great doctors here and everything. So, and Dr. Stu, hello.
Namaste.
You look different today. You look different. You got a different hat on. I love it.
Yeah. So
Anshul, I'll take your
this
leave.
is just
Okay,
yeah.
Dr.
It
Good.
was nice to hear you, Dr. Rajat. So
Thank
the
you,
valid
sir.
point I was listening when I was on backstage. So I think for the pain management, it is nowadays it is a very good field if you can take care of the patient's pain. Thank you so much, Dr. Rajat.
Thank you,
Thank
sir.
you. And thank you for sharing with us some of these great ideas because, you know,
Yeah,
when
yeah.
you're sitting at home in pain, it's hard to motivate. So I appreciate your time. Thank you.
Yeah.
Okay,
Hi, Dr. Rahul.
Dr. Raul and Dr. Sagu. I feel so
Hi.
blessed
Rakesh,
surrounded by doctors.
Rakeshji, Ankit, and Ken. Yeah. How are you?
Yes.
How are
Anyway,
you doing?
doing great. It's Friday, right? I don't know one day from the other anymore, but how are you doing?
Yeah, I'm doing good. I went through a small procedure a few days back. That's why I was absent. I was not able to come online.
So you're healthy now?
Yeah.
Oh, good. So did you shave your beard or something? Cut your beard or
No. I never shaved my beard
you never shaved
in
your
my. I never shaved my beard in my life.
Okay, but did you
I
you look different today. You just look different.
because of the turban. Because
Okay.
today I'm wearing the cap.
You're
It's
wearing
a surgical cap which we use. Yeah.
Okay. Yeah, no. So I like the surgical cap. It's pretty cool.
Yeah.
So you doing surgery today?
Yeah, I did yesterday also and day before yesterday also, and I tried not to wear the turban nowadays while going to my OTs and all, so that because we have to wash everything whenever we came from the OT and from the hospital, so that is why the cap can easily be managed. So that is the only reason that I put my cap. After so many years, this cap is from American College of Surgeons, Chicago, when I was doing fellowship over there.
No. So tell us some of the things that you're seeing recently. You know, it looks like maybe COVID is not slowing down, but you know, we hear that there's 2 more weeks of shutdown. But what are some of the things in your life that are turning around now?
I think
Okay. So we can switch back to Dr. Raul because he was kind of here first anyway. So Dr. Raul, share with us what's going on.
See, with respect to COVID, the doubling time in India has increased to 12.5 days now. Okay, we are on a way of partial lockdown resolution procedures. I don't know how successful we would be, but the government has taken a stand to bring down the lockdown now in the city all across in a graded fashion. See, this is important because the economy cannot be left to be stagnancy. You know, we all need to start living with the virus with the adequate safety precautions. with a proper positive attitude. And we have moved some proposals to the ICMR on our own personal capacity. They are under consideration by the ICMR.
No, I agree. I think this is something that we've been talking about for a while now, that we just have to learn to start living with it. But I think we had to get it under control and figure it out, because we didn't want such a high death rate like we have in the U.S. right now, which is still concerning to me, that we are still experiencing such an incline that we haven't even come. They keep saying, "Oh, we're plateauing." We're still doing this. I don't see how the numbers are going up, that we've plateaued any at all. But it's keeping the mindset, the people from going crazy. I think Dr. Segura brought this up too a few weeks ago, that we just have to mentally stay well now, not just physically, but and those are the good conversations we need to be having. We talked about our good standards of washing our hands. How do you wash your hands?
Yeah.
The difference between wearing a mask and not wearing a mask. Why is it important? There was such a big controversy, but I think people didn't understand that it wasn't about protecting you. It was more about protecting other people from what you might have. But and I'll address Dr. Scoob with this question, and then you. But do you foresee us re-entering with masks, but maybe in the future that masks won't be as necessary?
Don't think so much. If the ventilation is maintained well, the aeration of the rooms are well, I don't think so wearing a mask or not wearing a mask will make much of a difference, because the viral particles are not known to aggregate. In a breezy atmosphere, they are just known to disseminate in the atmosphere. And that is what is important. There is a loading dose of virus, which is important to infect a person. If the room is well ventilated, right, they've shown on thermal cameras, the loading dose is not reached. As compared to a closed room, which is an air-conditioned room, there your masks will play a role, because of no breezy air, the viral particles will remain in air, and they can travel a distance of more than 4 meters in a closed controlled environment. So there I would suggest we will need a mask, because we have definite evidence by infrared cameras. And in a breezy atmosphere, I don't think so we will require a mask. We can just enjoy fresh air, which is being formed.
I do that now. I go out in my backyard, but there's nobody around me for 2 or 3 acres. So the only thing I have are deer, foxes, raccoons. So I don't, unless they're contagious and have something. The worst thing that we feared out here were ticks and snakes. But Dr. Segoo, what are your thoughts on that? I guess it's important for reentry maybe to do masks, but what are your thoughts on that?
Yeah, I would definitely agree with Dr. Rahul, which he has made the comment about the lifting up of the lockdown and changing the lifestyle. And we need to change the lifestyle forever, I think, from now. And if you are sitting in a room, in a house, and your room is very well ventilated and there is no AC is not on, it's not a closed room, I don't think you need to wear the mask. But yes, whenever you go out, you should wear a mask now. So the mask would be compulsory now while going out, to protect yourself and protect the others also.
I agree. And we're talking about just learning to live with it, but that's improving our health. And I'm thinking maybe we can develop together as a team an app that we can allow people to help develop better eating habits, reduce obesity, and increase immunity, right? And I think that this would be very, very important.
Yes. I mean, the lifestyle change has to be everywhere, whether it is an eating habit, whether it is a physical activity habit, whether it is a sleeping habit, whether it is a mental habit, whether it is, meeting habits also, consulting habits also. So each and everything, the concept for everything, protocol for everything is going to change now. And I think we should live with the virus, and we should live with the new lifestyle changes. Right? It is very important. So because obesity is going to be a very dangerous now. It's a risky factor if we talk about the diabetes, hypertension, other chronic disorders. If we talk about the even COVID also, because the obesity is going to compromise your lungs. Would Dr. Rahul would agree with me? So because of
Yes.
compromisation of the lungs, your lower lobe of the lungs, they are compromised
Mm.
because of the obesity. Because you are not able to breathe out and breathe in properly. You are doing some shallow breathing. You are not
Mm.
doing the deep breathing. So when the deep breathing is not there, the bottom of your lungs, they are not opening up well. So when the bottom of the lungs, they are not going to opening up well, so they are going to invite lot of things, not only the disease related to the lungs, disease related to everything. So many things are going to be there when the obesity is there. And obesity is always a man-made. The obesity, we are the only culprit for that. It is a man-made.
You're
It
right.
is. It, yeah. Yeah.
Thank you. And you know what I get frustrated about is they'll put people who are highly obese on disability checks here, right? Where they can get disability checks. And I go, but they brought this on themselves. It was hard for me to, in fact, I never got disability, and that might have been a blessing because I work and my mind stays preoccupied. Like we talked, that's a good thing. But obesity is man made. That is a man
Yeah.
made disease. And
Yeah.
we
So
need to fix that.
we are fighting with the pandemic, the COVID pandemic, but we already have a obesity pandemic. So do we need to fight with this obesity pandemic, which is man-made?
And we're dealing with, like you said, the obesity and the lungs. We've got two great experts here to talk about these two things. But when you are healthier and you're breathing healthier and you're filling your body in full capacity of all the oxygen it needs, all the hydration it needs, you don't need all that junk food. You don't
Yeah.
you don't feed it all of that comfort junk food when you're exercising right, your lungs are feeling good, your heart's feeling good. You don't need the bad food. And I don't think people see that. They don't recognize that.
Yeah. I think with the economic background now, because the economy is going down, so the choices from the unhealthy food will directly come to the healthy foods.
Do
The
you think
choices from the restaurant made food will go to the homemade food.
But
The
Dr.
choices for a lot of cars and everything will go to now the walking. We can go to the bicycle also. So I mean, this pandemic is going to change, and you never know. Maybe good for the pandemic which we are already fighting, that is obesity.
well, I
But
think
Dr. Guru, do you think that those people who are doing those fast food chains and they are creating those foods for us, both on television as well as on the real restaurant, they will come up with an idea and to sell those food at a cheaper price because it's difficult to get healthy food at a good price.
it
But
is.
you'll get those food at a very low cost. And I think Mansi would agree to me because she manages the mental side of the uh, things. So how people will decide because they watch those McDonald's ads on regularly on television and they don't see doctors on television, but those McDonald's and those pizzas are also on television whenever you go on it. It's difficult to unlearn things and then buy those healthy food. What do you think?
Yeah, I think it's very true. It's like, they'll start offering salad free with fries, and that doesn't help us at all. You know what I mean? I mean, in the larger aspect of public health, that is just unhealthy eating. And they are businesses. At the end of the day, they are going to obviously come up with ideas to try and sell, what they stand for. So that's always going to be there. But I think Dr. Here is right. Dr. Saku here is right when he says that, people are going to have to bring healthy choices of lifestyle and food because it is, it's part of all that immunity growth of the system, which is being promoted on so many platforms at the moment. So I'm personally a pharmacist and a mental health advocate. So while dealing, on a mental health platform as well, we have so many discussions where we talk about how the immunity goes down when people are in a lot of stress, which is currently the case anyway because of so many people losing jobs. There is so much uncertainty over so many things in life. So I think food is going to play a major role in each and every area. And with respect to immunity especially, I mean, there are so many Ayurvedic formulations coming up as well who claim, to make up for the immune system. So I think food will be there will be a major change in the type of food moving forward now after the, seeing the pandemic effect. People will understand that in a better way, that we need to take care of our, lifestyle and food habits.
Yeah, I agree. I think the way we start eating, I think breathing in more, filling our lungs at more full capacity. We fulfill our bodies and minds. I think we need less junk food, but junk food's so cheap. Here it's
and
kids with a bag of chips.
yeah,
A lot.
But I have a question from all the doctors, because whenever you visit a hospital, you'll find junk foods available at hospital as well. Sorry to say, but why we don't counter that? Because I mean, I know that there are healthy foods as well, but there are a lot of food which is not good for health, but that is not available around hospitals as well. So, Dr. Rahul,
See, Ankit, one has to make a strong balance between the kind of food the people would like to eat and a healthy food stuff, right? You just cannot pump in a food which is healthy into somebody who's not willing to take or eat it, right? So, based on people's choice, after all, at the end of the day, the cafeteria is a business. They have to earn profits to make the things running. So, they will keep the food which the public will want to eat rather than which is healthier for them to eat, right? So the way we educate the people in our health sessions, like health checkups, will play a vital role in helping the people to make a good choice of food. Ankit, now taking you slightly off the track. If I tell you we don't have to live with COVID for a long time, what would you say?
I will just follow your guidance.
Yeah, the reason why I'm trying to tell you this is by scanning the research papers recently, we have come across something very good from the country of United States of America. Very strong research has come up to show us that UVC lights of 222 nanometers, far wave UVC lights, have known to destroy the virus, but have not known to cause cancerous lesions on the skin. There are ample of white papers published on this right now. And deploying UVC in a controlled and a graded fashion, that is what we are looking in our setups right now, feasibility of deploying UVC lights and disrupting the chain of virus transmission. And I'm already talking to a lot of people in United States, my friends. They have deployed it, they have found it useful. In India, in our center, we are trying to deploy it and destroy the chain of transmission of this virus. Once we have that achieved, I don't think so we'll have to live with COVID for a long time. Gone are the days of old time sodium hypochlorite solution, formaldehyde to be used as disinfectants. Now, this virus pandemic has changed the way we think.
Yeah.
It has changed a lot of things in our practice. And we are forced to adapt. See, earlier UVC lights were recommended by WHO for TB sterilization, and what WHO websites mentioned. But we were so resistant to adopt them because there are so many other choices available with us. Now this virus has virtually eliminated the rest of the choices for us, except this choice which remains. So they are already.
You will see UV lights containing all those contamination area, or I mean, how you will be using it?
See,
I'm curious about that. That's interesting to me because I know about the germicidal lasers.
What I have proposed in our setup is identify the zones of high contamination first by taking swabs. Where the zones of high contamination are there, the UV lights will be placed close to the floor because it has been shown this virus does not remain suspended in air for a long time. It settles on the floor, settles on the surface. So those surfaces will be taken care of first. Second thing, we are trying to get in touch with the US producers, the makers of this UV light, and get in touch with them for solutions to a CT scan department or radiology department, waiting areas, where these lamps can just be put on, 24 by 7 hours a day, and sufficient disinfection can be achieved. Mind you, the UV lamps which are available on the internet website, so they mention 222 wavelength, right? It's not 222 nm, it's 222 volts. And when you see the specifications, it's either 286, 350 nanometers, which is harmful to the skin. Because we are doing a lot of search in this area, because we quickly want to come out with a remedy before it strikes to rain. The first rain hits the city of Mumbai.
No, that's interesting. I love this research and technology with the ultraviolet.
Yeah, Dr. Rahul, I have a question. So,
Yes, sir.
don't you think living with the COVID would be better than living with the lot of side effect of the UV light? Because
Sir,
this is the new addition of the family. You know, the COVID-19 is a new addition to the family. You have seen the SARS has come, the influenza has come, HIV has come, HBS antigen has come. A lot of viruses has come, and they have become the member of the family. So right now, pandemic is because we don't have anything against or anything to fight with this COVID-19. Once we get the vaccines, once we get the drugs, when we get the hard immunity against this virus, and this would be a normal virus like an influenza virus. So why to use the UV lights for this COVID-19? Because UV lights itself, it has a lot of side effects. It can lead to a lot of skin conditions also. It can lead to burning of the eyes, burning of the cornea. There is a lot of corneal diseases there. So if we can do the simple preventive measures like hand washing, because soap and water is the best method now. I mean, you don't need a sanitizer also. So if we are doing the social distancing, if we are disinfecting the walls by the sodium hypochlorite, so would you think that UV light would be better, and it will not harm our life, and it will not cause some other diseases which we are not aware of right now?
Good question, Dr. Sagu. Let me answer this question. Sodium hypochlorite and all our man-made measures will suffice only till the rain does not start falling. Once the monsoon sets in, there will be a mayhem, right? And it's very difficult to maintain cleanliness. Number one. Number two, categorically since 2017, it has been shown by the UV light research that the wavelength of 222 nanometers and less nanometers, right, have no penetration virtually to human skin. Okay, sir. Now, what is the problem is we have never used 22 nanometers for the extensive general purpose. What we have used is 258 nanometers, 350 nanometers for germicidal purposes, right? So those are having a good penetration stratum corneum, and they can cause what you have said, sir. But 222 nanometers have been tried extensively by people in a controlled environment, and we have found, and they have found that it does not penetrate the human skin and does not cause any carcinogenic effects. There's no keratitis on the cornea. So my question to myself is, would I change the way I think, break down the traditional locks, and adapt to something which is beneficial for my people? See, because all said and done, it is very difficult to maintain a clean environment in our country, sir. Whatever hypochlorite you use, whatever disinfectant you use, sir. And putting a UV lamp is just very simple. Just a button switched on, it functions like a normal bulb, right, sir? And the amount of radiation released, you see, what is important is for the source where you buy your UV lamps from. If you buy from Alibaba or other sites, they put there 222 nanometers. But if you read the specification, it is not 222 nanometers, it's 250, 280, 350, 360 nanometers, right? So exactly the sellers are playing away with our psychology to give us a higher dose of radiation.
That may be true. So my concern is, I mean, I don't think we need to have a cleanliness and everything, all the measures which we are following right now for the long period. Maybe like, influenza is now, we are not following any measures against influenza. So even the influenza is coming and going. So maybe the COVID-19 will be also coming and going. Even during this pandemic also, around 80% patients, they were asymptomatic or mild. Even a lot of asymptomatic patients, they are getting this COVID-19, and it's they are fighting well because their defense system, their immunity is very good. So it is coming and going. I don't think it would be of great worry until unless you don't have a major uncontrolled disease, you don't have a respiratory compromise, you don't have a cardiopulmonary compromise. So that was my concern. I think you're the best concern and expert for that. So thank you so much.
May I try to value your question a bit further?
Yeah.
The reproductive index R factor for this COVID virus is 2. In 10 cycles, it can infect 2,000 people. That is the contagiosity of this disease. As against influenza virus, it can only infect 20 or 30 people in 10 reproduction cycles. And another thing is this virus has mutated 30 times now. There are more than 341 species on record online of this virus itself. This virus is known to transmit to the animals. Also, now tiger was one published, dogs are another whole reservoirs for this. So, sir, in the virus which is strongly mutant, number one, where your therapies are known to fail very quickly. See, we have always been hearing that the therapy has come for this virus, then we find out the therapy has failed in this virus. There's always a series of coming off drugs and going off drugs. If you carefully look at the research protocols also, we have lost drugs very quickly. For such a disease, we are losing our arsenal quickly, sir. I would rather be on an aggression rather than wait for the herd immunity to come. See, herd immunity in UK is also now not more than 4%, which would hardly benefit a population. Save it, sir.
I think there is more concern for the immunocompromised patients. They are a major concern in all of this. I mean, respectfully agreeing with Dr. Rahul there that any sort of cure or any sort of therapy, while agreeing with you, Dr. Sagu, that thinking about the side effects of them at the same time. But if we have to put some, go down the aggressive road, then that is the major benefit for immunocompromised patients, I think, across the world. And I think that is a major healthcare concern right now.
But that UV lamp is only for the hospitals. I think Dr. Rahul is talking about that we are putting in the code of the hospitals only, not not at every place. So for the hospitals, maybe I have not tried that. It would be good. So my concern is only that because the enemy is very strange to us now. That is unseen. We cannot see. It's invisible, and we don't know the strategy of the enemy. So after understanding the strategy of the enemy, we can make a strategy. And once the time will pass, I think we would have a good strategy. I will give you a very good example. If you are fond of cricket, there was one bowler from Sri Lanka, that is Ajantha Mendis. So he used to rotate the ball. And initially the top batsmen of world, I'm talking about the world, they were having a lot of difficulties to playing that bowler. Even the Tendulkar was not able to play 2 balls by Ajantha Mendis. And once initially he took around 5 wickets in 1 over. What happened to Ajantha Mendis? After 2-3 matches, every ball was going for the 6 and boundaries. So, initially you don't know the strategy of your enemy, but once you become very unstable to the strategy of the enemy, you can play well.
Agreed to you, sir. We can play well once you understand the strategy of this enemy. But looking at this virus, there are so many controversial issues, which I would not like to bring up on this chat show. It would be better if we talk on a personal level. This virus has eaten up our medicines like crazy stuff, number one. Number two, the prediction of presentability is changing now every single moment. Earlier, we never had a presentation of Guillain-Barré syndrome with this virus. Now we are having people coming in with acute flaccid paralysis, acute renal failure, asymptomatic for a long time, sir. So having put all the things together, what we propose is the hospitals are becoming a secondary source of contamination to the society because all the viruses, people are coming to the hospital and they are shedding the viruses there, and the healthcare workers are taking it back home. So our proposal is to control the secondary source, hospital for becoming a secondary source, and the environment will take care of itself. Like I said, a well-ventilated air does not let the loading dose to accumulate, right, sir? So we need to adopt a strategy in between the two, that not over dependence on UVC, because to get a pure UVC, you need a monochromatic UVC lamp source. If you don't have a monochromatic lamp source, you'll have UV and UVB, which are toxic. So like that, there's a lot of thinking to be going in to purchase this also from an appropriate source and a very standardized source. Because there's so many people, you hear tomorrow, the other day I heard ophthalmologist had made a battery, torch, which would emit UVC, and who would be putting in patient's throat. But video
Yeah.
has come out from Gujarat, right?
Yeah.
So,
yeah.
who has tested the quality of that? See, because I believe to make a lamp, you need a glass furnace, you need an
Yeah.
electrode diode, you need a
Yeah.
pottery. Yeah, these things are
Yeah.
not easily available in everybody's home.
Yeah.
Probably our friend has borrowed the lamp from somewhere, jigsawed it into
Yeah.
a torch, and then how can you guarantee that it will only admit 222 nanometers? And we are not fooled by the way 222 nanometers of the advertisement when it's 222 nanometers and it's going to 86
Agree,
nanometers.
Dr. Rahul. Fully agree with you. Yeah.
And
Yeah.
also,
Yeah.
Dr. Rahul and Dr. Sabu, I'll tell you, there's an advertisement going on the television right now, and they say that if you buy a spray to wash your vegetables and fruits, you are, sanitized your virus free. And I was amazed to see such an ad. I mean, I don't understand. They are using additional chemical on top of the vegetables.
Makes it toxic.
It's free from coronavirus. So, do you because yes, Dr. Sabu.
You know, the good articles, they doesn't need any type of advertisement.
Yeah, I completely agree. I mean, but
Yeah.
how can we allow these ads running? Because during this situation, I mean, everyone is following and they want to buy all the things, whatever is possible.
When you allow your liquor salesman to sell the liquor instead of giving the food, then it is. I mean, you can allow all the big companies to advertise their bad shit.
I think
Ankit, you can show the dollar again for the answer to your question. The dollar should come up.
Ankit, to tell you, Ankit, to
So
tell
you know,
we are not using it for the first time UVC in India. We have been using UVC at water purifying plants and other places. UVC at the community level has been successfully tried in Singapore.
Yeah.
In China also UVC robots have been tried.
Yeah.
Learning from them. We did a small experiment in my friend's hospital at US.
Yeah, Dr. Rahul, Chinese UV light doesn't have any nanometer, and
Sir,
you cannot prove that.
So let me come to you. We have always we don't take them at the face value. We learn, adapt to a true thing. But nevertheless, they have come out with the greatest number of such papers, right? And if we analyze it carefully, sir, it is very stupid on my part to wash them off as manipulated or not standardized, because because they have come up with very good treatment, sir. And the way the Singapore has controlled the COVID virus infection is a learning point for all of us.
Yeah.
Yes,
The vast diversity we have.
I fully agree. The way the Singapore, the New Zealand, they have controlled this virus, I think we should learn a lesson from them.
There is a news from South Korea about some disinfections and some different disease coming up. Do you have any idea about that?
Some instances of Zika virus were reported, but not so many.
Africa. I just try to pull it up in the meantime.
Okay.
There's
even
they're isolating it down. I truly believe that if we could just narrow this down, do some testing, get some early detection, right? So if we can get early detection, I know all the tests are not 100%, but nothing's 100%, but it's better than doing nothing. But I think if we can get early detection, early treatments, we can reduce the infectious rates, the spreads. What do you think?
Kim, with regards to that, my proposal is already pending with the ICMR. It's moved day before yesterday night by a member of parliament to the health secretary and other people.
Congratulations.
Where we have compiled a lot of study reports across the place for salivary specimen, and they are studying it. If they find it feasible, soon in India we will have nasopharyngeal swabs being replaced by salivary sample RT-PCR. And the beauty is that we don't need a different kits for salivary sample RT-PCR. The same nasopharyngeal kits can be validated for salivary sample also. So this is under process in our country right now. So if they find it valuable, they go ahead and implement it.
Well, congratulations. And I know that takes a lot of research to prepare a proposal in the medical industry. So thank you very much for your efforts. But like I said, we're all about the solutions here. We want to hear them and share them with the rest of the world, so that we can get this under control, because this isn't impacting just one country. Are you leaving?
Yeah.
Oh,
So I have to leave now, please. I'll take your leave, Kim. Thank you so much.
I'm
Dr.
glad
Rahul,
you're doing
Mansi.
better.
Thank you, sir.
Yeah. Bye-bye. See you.
Feeling better. Bye, Dr.
Bye, sir.
We lost meeting. We lost. Okay. Anyway, you were talking about earlier we were talking about music healing us, right? So here we've got our beautiful musician artist and Alexandra with her musical cafe on Sunday. So she interviews some of the world's leading people in the music industry, shares great music, happiness. Yay!
Yeah.
Makes us all feel like we're together.
Yes, it does.
Alone. Does it feel good when you're doing this? I know it does, but share with the world. You feel better, don't you?
Yeah, I say it every time. The Sunday is like the highlight of my week because it is getting together with like-minded people who enjoy the same thing as me. But also it's because even though I do it as a job, it's still an art that I admire and I treasure and I see as a gift. So I love seeing people doing what they do best, So this week, I'm so excited. We've got a bit of a music / cinematography kind of theme. So we have a composer / conductor. His name is Simon Holt. He lives in Australia. I think he lives in Sydney, which is quite cool. And he's actually toured with many musicals around the world. We also have a beautiful lady called Anna. She is Russian and she does bits and pieces as well. She has been an assistant director, also does her own filming, cinematography vibes. So just really interesting to see what she does from that perspective. Then we have a really cool guy called Richard Gower. He's from South Africa and he is an actor / singer, songwriter, musical theater, TV, and has his own vlogs and he does these sort of things every week and all, and he's also really talented. And then last but not least, we have a really cool guy who I actually met on IBM called Wesley Elder, and he is a producer / actor / director, everything as well, and he is in America. So I'm interested to find out when it comes to music in film, how it works, how they pick music to fit a certain mood. And then I know a lot of these guys like Wesley started in theater and Richard does theater and music. So music and writing songs is all part of their DNA. So there will be a little bit of a writer's round, which will be great. And then lots of chatting about some fun things to do in this world and what else to look forward to and what else to look forward to during lockdown if you're in lockdown or in quarantine or whatever. So there's stuff to keep you busy,
Well, I want to tell somebody, or not somebody, everybody, if you think about it, singing is great lung exercise, right? You're filling your lungs, you're holding the note and playing the note. So what great exercise. I mean, I'm a swimmer by nature, but yes. And
we have Dr. Rahul with us, and he is a lung specialist as well.
That's why I had to say that. I had to say
that. Last week he shared a beautiful song with us, and I think he has one more song, for us and our viewers. Dr. Rahul, are you ready? We have Alexandra. She'll join you once you start.
Okay. So, would you like to hear the song or the poetry?
Both the things.
Both.
Both the things. Okay, so let me tell you a poetry first. A virus with a crown has forced this world to pace down, creating great fear, filling the eyes with tears, with its frown causing the nations to drown. Religion has lost its importance as the virus kills humans like an ace. Mutating fast, it changes its face, making it difficult to identify a case. The governments take a stand and everyone join their hands to do their bit so that the transmission of virus is hit. The medical fraternity takes the front line, risking and sacrificing their lives to save a life. And the researchers stand along in sleepless nights, trying to find a way to win this fight. The bond of love goes strong, and hands join to save lives in the storm. With a strong zeal to persist, we'll win this fight to exist.
Wow.
That is
amazing.
Amazing. Thank you. We need these things to inspire us.
I think the best part is that, Dr. Rahul have used a lot of health-related words in the poem, and that is a good part because people generally don't use those words. But that was a good poem, sir. Thank you.
Thank you.
Thank you. Yes.
A lung specialist and an artist. I mean, wow. I mean, it's such a blessing. But I just think it's good.
You're so right in saying that. I mean, I don't really know a lot about biology and how it all works. I'm sure our doctor will be able to correct me. But when it comes to the arts, you're 100% correct when you say it is great exercise. It's about keeping fit because you're not just using your throat to sing. You're using your entire body. You're using your toes to sing, and it's about posture. It's making sure that your diaphragm works. And I even said last week that I used to sing opera in like full-on ball gowns and corsets. So you'd have to sing against.
We got bouncy here. Bouncy. Okay, but go ahead. But
yeah,
corsets on and
so you'd have to sing against that. So it's all about posture and how you breathe, how you stand. So it is actually great exercise. And even just doing poetry, and I remember doing drama and doing these monologues on stage, you'd have to stand there and breathe deep enough to be able to project. So, and without hurting your throat, it's about using your diaphragm. So and even my sister who does ventriloquism, she throws her voice. So it's a whole nother technique. But it's if you're looking for some fun exercise, sing a song.
But it does. I mean, it really exercises the capacity of the lungs. I was able to take some music when I was in high school. And that's one of the things it told me was you had to practice breathing.
Yeah.
Before we could sing. We made us practice all of these breathing techniques. When I first started, I felt like I was going to pass out. Even though I was a good swimmer, I felt like I was, that was some exercise. And I'm like, wow, this is pretty amazing. But to have a lung specialist here, share with us his poetry, his music, and everything, and he's been so inspirational on some of the things that we're heading into in our society about living with the virus.
Yeah.
And I think that's going to be our next song is Living with the Virus.
It's no longer breakup songs, it's Living with the Virus.
I just want people to know, if you want to take a break from virus talks, we've turned Sunday into a beautiful, inspirational Children's Day, live music day.
I love that.
And in fact, Ankit and I have taken the news hour away. So, are we having problems with it?
Yeah, looks like I think.
Okay. So let's where is the noise coming from?
I'm not sure. There is something
interesting going on here. I can't hear you guys.
Dr. Rahul.
Exit out and come back in. Dr. Yu is on. Ask me to exit out and come back in. So Alexandra, you shared with us who's going to be your guest this week. You never cease to amaze me. You did all of these amazing rocking. That takes a lot of work. It takes a lot of work.
That's an understatement. You know better than anyone. I've been working professionally since I was 12 years old, and my first paycheck when I was 12. So I mean, I'm 24 now, so it's been a few years. It is a lot of work, but it's so fun to wake up every day and to know that this is my job. I'm actually busy doing a project for my church, like our youth, our young adults. And I'm literally getting stuff in, and we're doing like these songs. I'm getting the drummer to do this, and the violinist to do this, and the guitarist to do this. I'm just putting it all together. And then somebody sent me a voice note saying, "When is the deadline?" I'm like, "Saturday night, like tomorrow," because I just sit there, and this is what I do all day. So I forget that people have like other stuff. This is just what I do. I sit and I'm working the whole time. I'm making music, so it's weird to like click out of the music space and go into normal space. It's not normal for me. I'm used to this.
What's interesting is we were talking about this today as far as pain management. It's good to keep your mind preoccupied. because if you're sick and feeling low, it actually gives you energy to get out there and do another purpose. Like you're doing things for church, you're doing another purpose. And sometimes it takes your mind off of you, your problems, and it's energizing. It really, really is. I mean,
that is so true.
I find myself, it's hard for me to say no, right? That's the other problem I have. If somebody says, hey, Kim, we do this, we do that. I just always find a way to do it, right?
Yeah.
And, so sometimes I forget to not get enough sleep, which is what we talked about today, is very, very important. So you're a lot like me when it comes to, you're going to, in there, you're going to help everybody you can, but remember to take a break for yourself.
And to know when to say no, because it's like a word that I like don't know, and it's such a dirty word as well. You know, like nobody like no, she said no. How dare you? But no, you're right. I've actually can tell you I've actually blocked off, and my entire life I've had all my muso friends say that Mondays are their Sundays. Like Monday is because they giggle weekend and Monday is their Sunday, and I've always thought, no, just keep going. Just keep going. I'm getting to the age where I need a day.
Yeah.
So I literally do the show on the Sunday nights, and I go to bed at like 1 o'clock in the morning because I'm packing down and I'm unwinding because I'm full of energy and everything. And then Monday morning I have a live thing on my Instagram, which I do every Monday with a cup of coffee at 10 a.m. and I get back into it. And then the rest of the day is all me. That's it. I vegetate. That is what I do on a Monday. And it's so important because I think especially at the beginning of this thing, everybody was saying, we've got X amount of weeks. What can we do with this time? Go, 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 go. And people that weren't doing anything were feeling like they were lazy and they weren't like contributing. But there has to be a balance. You can't just go, 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 go. You have to take time to say no. I need me time. Watch a Netflix series, have hot chocolate, eat cake, all the important things. Like you need that time for yourself.
You need a balance. You probably you've learned it at a very young age. When I was running a phone company, I kid you not, this was back in the day before there were people using mobile phones at a great deal.
Right.
I owned a land company, local area exchange carrier, and I had literally 3 headphones on my head. I had 3 phones.
You have 2 ears though. What's going on with you?
Yeah, my doctor asked the same thing. When I went in to visit my mom, she had a heart attack, and I went to the hospital to see her. I was like, I had a belt on and all these phones and headsets, and he asked me the same thing. You only have 2 ears, girl. You're driving yourself to a heart attack.
Yeah.
I thrived on that, right? I thrived on always go, go, go. If I didn't have it, I always felt like I wasn't doing enough. And so when I shut the company down and retired, I actually started having heart attacks or symptoms of heart attacks. And they were rushing me to the hospital. And the doctors were worried about me. They're going, are you under a lot of pressure? We know you closed the company down with the financial situations. And I go, no, I think I'm under pressure. Like, I don't have enough pressure. I don't have the 3 headsets. I was missing it. Like, I was sick about that addiction of not having enough phone calls coming in all day. I felt like I wasn't working anymore. But it was weird because I dealt with a lot of big issues, right? Federal regulations, fees, attorneys, other interconnections with AT&T. I dealt at very high level, and I never had a heart problem.
Wow. Yeah.
I get rid of it, and all of a sudden I'm in the hospital all the time going, I can't breathe. And I realized I was under pressure, like not enough.
Yeah.
So I think you're right. But I need to have my cake too, right? I need to rest.
It's so important, and I've spoken about it before, and I'm sorry for hugging the screen, but I you know me, I love this sort of conversation because I believe in it 110%. I had a panic attack last year when I was in Nashville, and I go to Nashville regularly, and that particular mid last year I had my very first big panic attack, and I've been under pressure for a good 3 years before that, leading up to that point, going to bed at 11, 12 o'clock at night, only waking up at 5, 6 o'clock in the morning, go, not eating properly. Not eating. To not have your break. I had to set an alarm. Have your breakfast. Have your snack. Have your lunch. Have your snack. Have a good dinner and have some dessert. And I had this breakdown. And I came home and it's because of all this pressure that I just wasn't taking care of myself. And exactly what happens to you, you get to the point where your body just can't take it anymore. And even though we're not doing anything now, it's still the same pressure because it's everything else that's putting pressure on you. So yeah, I believe in that piece of cake. I believe in that Netflix series. I believe in that book. So
exactly.
Yes.
And that's something I really haven't done a lot of because when we locked down, I got busier than ever. And so I'm looking forward to some slowdown. Nick has been tag teaming with us so that we can get that time out as well. Because, Mondays were always my bookkeeping and accounting days. And I've literally not done 1 ounce of bookkeeping or accounting for 60 days. Wow. It's like, I know, right? Yeah, girl, because I lecture on this. I lecture on having that day, like you said, having that day to shut down. But Mondays were always my bookkeeping, get everything organized in life, and I'm panicking now because I haven't done that. But now I don't want to. Once you get to that point, you don't want to. But I want to talk to, because we've got Dr. Rowe and Dr. Yu on, but I want to ask this question about the breathing part. When we have panic attacks, it's like you can't breathe enough. What is going on with that? Why do you feel like your lungs are crushing?
Can I take that question, Ankit?
Yes, I want you to have that question.
See, this is the position of your vocal cords, the 2 fingers. When you breathe in, these go away. When you breathe out, they are away, right? During breathing exercises. When the panic attack comes, they come together and block your airway so that you feel choked. And then you have to take a breath, voluntarily bring them apart, right?
Wow.
So that is the place which happens during the panic attack. You have stronger tightness in the midline, in the center here, and you feel like you're sweating. The vasovagal sympathetic stimulation comes up, right? And if the panic attack is too strong, then you need to sedate, paralyze the patient, and take him over on the ventilator. Mind you, there's an entity called as vocal cord dysfunction, which mimics asthma in symptoms, right? And panic attacks and these always happen when we do not deal with stress and we just tend to ignore it, right? And it gradually builds up to a point where the body says, hands up, no more. Now I'm going to give you something. You have better stop, right? So in our life, there's a lot of stress, but we have learned to take care of it. I have adopted a measure in an hour. Last 10 minutes of an hour while working, I'll stop my work and listen to music, worship music, gospel music. I will sing a song, right? I'll read the scripture from the Bible, and then I will go on. Then again, in the next 1 hour, for the last 10 minutes, I'll see to it that whatever work I'm doing, just put it at rest. Unless it's an urgent procedure or something, I'll go back to my closet to on the music, listen to music again. This technique I found out in my MBBS postgraduate exam time. I had only 20 days to give an exam, and I have to finish somewhere close to 10,000 pages. So that amount involved a lot of studying. So I devised this thing, and this helped me, and continues to keep helping me.
Okay. So I think Alexandra has to beam out. Can we play a typical girl real quick?
Yeah. Do you? Do you have the video? Oh, it's still sending.
Just to tell people when you're playing. Ankit, do you have it?
No, I don't
we'll
have it.
We'll play it later. We'll play it for the day. There we go. Here's our guest this week, and we look forward to seeing you.
Yay! I'll see you then.
See you Sunday for some music to build our spirits up. No stress.
Thank you. No stress. Hashtag. Bye, guys. Bye, everybody. Bye.
All right, Dr. Yu, how are you doing?
I'm so glad Raul was talking about just taking little breaks throughout the day, and we're just so on the same page because he talked about the physiological aspect of stress and then the spiritual aspect. So, and they're all intertwined. The vagus nerve controls your dopamine production, and your heart rate and your digestion. It's a really long nerve. You know, Vegas means, Las Vegas means the wanderer. This nerve wanders. You know, cranial nerve 10, right? So when you're stressed, you get the sympathetic vagal response. Your heart rate goes up. Actually, probably less dopamine is being produced, so you can't relax your muscles, and your digestion stops, right? You get constipation. Your heart rate, breathing gets out of control. So you have to do, you know, vagal calming exercise to get the parasympathetic working, diaphragmatic breathing, relax the lungs, the trachea where it splits, what he's talking about.
So, you know, you missed part of the conversation. I was hoping that you were going to beam in. We were talking about using the lasers for the COVID. Dr. Rule has been working on a paper about this, and you're in the laser.
That's a third. I mean, Rule's, he's a brother from another mother. I mean,
I tell you,
I can't believe this. So,
and
that being said,
his paper is
yeah.
in process.
Now, I'll get into the UV light and methylene blue study they're using in Canada, reversing the COVID symptoms, you know, very fast. But let me just say, we talked about exercise, right? So, you know, I'm always experimenting with different gadgets, right? So this is a Japanese device. This is actually an air compressor, and what it does, you hook these tubes to your arms and legs, and there's air bladders, all right? I'll turn it on. And this is the Pro Cycle. And then I'm going to put it on low. There's different low, medium, high. This is a warm-up. I don't know if you see the numbers going up and down.
Well, just barely, yes.
Yeah,
Now we see them, yes.
That's the air, how many PSI. So it's constricting my blood flow in my muscle, and then to relax it. And through the tourniquet method, you're getting shots of blood going down to your extremities, legs and arms, and also your whole body. So it's almost like a second heart where it's tricking your body. You're doing more resistance exercise, but you don't have to lift weights. And it increases growth hormone and more blood flow. As we get older, our circulation decreases, takes pressure off the heart.
Yeah.
It shunts oxygen to your whole body. So especially for our senior patients who are disabled, stroke, or anything, people with numbness in the arms and hands, this is diabetes, you know, they get the diabetic ulcer, amputation. It's all about blood flow. And if blood and oxygen are not going to your extremities, your heart, brain, that's what causes a lot of these degenerative diseases. So this really increases your blood flow. It's like having, I got 2 hearts on right now. And guess what? You don't need to lift weights because this is constricting your muscle. Look, and you're getting a pump. So you're making lactic acid, which increases growth hormone release, more circulation, more of your body's endogenous stem cells to circulate around, more nitric oxide to dilate the blood vessels, to prevent atherosclerosis. So I'm going to implement this into our stem cell therapy program. Like during a stem cell injection, we're going to put the cuffs on, and as it's cooling blood and growth factors and oxygen to support the stem cells so they grow and repair faster, and stem cell rehabilitation after the injection to get more blood and growth factors and oxygen to keep the stem cells growing. This is the perfect device, especially for people who don't like running or, you know, extraneous weight training, but they want the growth hormone, the muscle building, the bone building, the increased circulation attributes of intense exercise. This is the perfect solution. So, yeah. Again,
you said nitric oxide. I was just ordering some. You can get that in Beats.
Well, yeah. Why pay for it? It's going to be expensive, $30-$60 a month, when your body can make its own.
Exactly.
Blood flow restriction and relaxation. Yeah,
No,
it's a perfect device.
I'm glad you did. That's why I'm saying I'm glad you just mentioned this, because I was looking at ordering some.
No, get this. Especially for you, you know, the lung constrictor. It'll relax you. You can do this several times a day. Take a break. This has 8 cycles it's going through, so it takes about 8 minutes, and then you're done. And you put the leg straps on.
That's my book. 8 minutes a day. So
there you go.
And let me.
It's like your Iron Man, right? Look, you put, or Darth Vader. You put it right here. Yeah.
So I'll just put it. But let me ask you this: so many people with diabetes, especially, the blood circulation is low in the legs. Is that something we could do to the legs?
Absolutely. There's leg straps like this, and then you put these straps on your legs.
Okay, that makes sense.
Just like this.
Dr. Yu, you have so many technical gadgets. I just love your enthusiasm in researching all the different.
Well, if you look at the movie Avengers, Iron Man, Tony Stark never sleeps. He's always inventing things in his basement. You know, this is my garage. I'm inventing things. So yeah, I would unplug this and hook it to here, and it would pump my leg and shoot blood and nitric oxide and growth hormone platelets down to my legs, especially for, diabetes it's on the rise, and sugar is very inflammatory. And diabetics, the sugar, it oxidizes. It becomes like hard crystals, like a rusty nail. Mm-hmm. And those sugar crystals oxidize, settle in your hands and feet. So it causes inflammation, swelling, sharp pains, numbness, loss of balance, nerve damage. So this will offset the inflammation that the diabetes and sugar is causing by getting more blood, more circulation, venous return, the lymphatics. The calves are your second heart and third. But if you're not walking because you have diabetes and your toes are cut off because you had an ulcer, you could just sit here and let this do the walking for you, the pumping for you. So that's why we got to take 10,000 steps a day, get the calves pumping the blood and the lymphatics out of your lower extremities. Like so many seniors have the swollen calves and feet, and there's risk of infection and all the peripheral neuropathy, nerve damage. So this is the perfect advice. I mean, yeah.
Well, and I think it's interesting that some of the things that you brought up, especially with the diabetes. Dr. Raul has to depart. He's got patients, and I appreciate you coming on.
Raul, let's get this for your patients.
There you go. And I want to talk more on the UV lights and your research, because I have dabbled in that for cleaning water. I've used germicide UV lights, and Dr. Yu does UV lights. So thank you so much for joining us today. We'll get this is a panel talk. That UV lights will be a panel talk.
Yeah, we can have a whole session. You guys, I can ship one to you guys, and then we can all do a Zoom Katsu workout. Katsu is Japanese for local constriction relaxation.
That works for me. But
yeah.
Thank you, Raul, for joining us. And one of the things I do want to talk about, though, is the UV light thing too, as well, because I know you work with that. And this, I love this. Send me one. You know what? That is a good idea. We'll do a fitness show. But we also have Dr. Jaden here from Infectious Diseases. How are you doing? Welcome.
Fine. How about you?
Hey, Dr. Jaden, he should be the CDC director. We got to fire Fauci and get somebody who knows what he's doing.
So here's the thing: it needs to be, CDC somewhere they lost the point of their position. We all pay them millions and millions of dollars a year, but somewhere they decided everything had to be classified. So no, we're paying you. Everything needs to be visual. Everything needs to be transparency. There is no intellectual property. We're in this.
When they start patenting vaccines and patenting viruses, right? It's kind of scary. Talk about conflict of interest. Oh, we're going to patent this vaccine. Oh, and by the way, this pharmaceutical company's going to sell it for us, you know. So
yeah, and what's Pirbright has been patenting viruses for years, the COVID virus actually. And I traced it this year. I don't know if you know anything about this, Dr. Janton, but I traced some things. I do a lot of research just out of hobby. And I discovered that Pirbright had, they do a lot of research with chickens in their lungs with COVID. Particularly, I think they said to find a vaccine to prevent it in livestock. But they had a big food conference in China. A security of food conference with all of this research that they were doing September 23rd through September 25th, which kind of would fit the timeline. It seems to me that if they were doing things around there and that disease just slipped out by accident, then, you know, like if they were having the conference, and this is what they're known for and famous for, it could have been an accident, but it was in China. That fits the timeline, you know, that, you know, they may have had chickens there that had the disease. The chickens accidentally got disposed of wrong and got to Wuhan. But when I look at the fact that this company who researches this disease, and they have this big, huge food security and food conference, and then we feel like that Ground Zero was a meat market, it just, the timeline fits that that could have been Ground Zero. And that could have been maybe something that they were researching that acts. I could be wrong, but it's just an idea. I'm glad you're here. I wanted to talk to you about that.
Yeah, Kimberly, I think your point is absolutely valid over here. I must tell you about that there are certain theories which have been put up about the origin of this virus. One of them was the leakage from the Wuhan lab. Second could be because of the animal that is from the wet market. And as we know from the recent cases also, that there are certain animals which have been exposed not only in the China, but also in the other parts of the world where the animals have been affected with this COVID-19. So certainly, yes, there can be, there are certain, animals, like even you talk about the chickens, they can acquire this kind of infection, and that could be a potential threat. But as we know that most of these chickens, they are properly grilled, properly cooked before we have them. So chances of getting the infection from the dead as well as the properly cooked animal, I think that is very barely minimal chances are there. But yes, they can be a contagious source when they are alive. From one chicken to the another chicken, that could be one of the potential threat to the for spreading.
Wow, and that's something to think about. I've heard, chickens can spread other diseases, so I've never been a big fan of chicken coops anyway. They have a lot of other diseases that they can spread, so I've always kind of stayed away from them. Thank you. I can see your face now. There you go. All right. I could not see your face just a minute ago. So, so what are some things that we're discovering moving forward? We've heard that 2 more weeks of shutdown in India. So what are some of the things that we're discovering?
I think we are almost the end of the lockdown phase 3. And from, I think, day after tomorrow, we'll be starting with the lockdown phase 4. We'll be entering in lockdown phase 4. So there will be certain easing up of those restrictions. We are seeing it in terms of transport, in terms of market openings, in terms of routine work which is going on in the daily basis life. But yes, at the same time, there are certain restrictions which cannot be eased up so early in the areas where so-called red hot zones basically in the Delhi, in cities like Bombay, and they are the areas in which still restriction has to be there. Otherwise, the cases would be multiplying n number of times. So as far as the rest of the country is concerned, yes, it's the high time we should start easing up the restriction so that the economy as well as the other parts of the society should keep growing up.
No, and there was some concern too because people are starting to go back to their farms and back out to the country. So, and this is, I know, part of what you do is how do you prevent flare-ups in those areas out there, so that, because you can't handle everyone getting sick out into the country, you just don't have the resources out there to contain it. So, is there anything being put in place for that?
Yeah, actually, when the the lockdown, in the mid of the lockdown phase 2 and the beginning of the lockdown 3, there were certain policies which have been made by the government of India, that those are the migrant workers who are going from one state to the another or to their native state. They are kept in quarantine and they are being looked for the any onset of the new onset symptoms. If they are getting the symptoms, they are getting isolated and treated, and even after COVID testing. But now the lot of the migrant workers from all over the state have started migrating from one to another state, another. When the special trains have been opened up for their movement to the respective states. So in such a large migration, it's very difficult for the government also to keep check everything. It's the duty of the now the individual, that they should be maintain the social distance and keep washing their hands, have mask at their face,
That's
and if required, frequent hand washing. Even with this, the Indian Railways also, what they're doing, they're providing the proper seat arrangements, the trains, as well as proper sanitization of the inner cabin, as well as providing of the adequate water and the sanitizing part in the respective stations. I think the government is doing best, but the population of 130 crore, and which almost most of them are migrant workers, and we can see that most of the migrant workers have started off their own to the by the road.
Yeah.
That's a very difficult task to manage. It's very difficult to manage lakhs of people on the road and provide them food, provide them shelter for quarantine, providing kit for the testing. I mean, it's a very difficult task. But yes, if they go back to their home, definitely the little chaos will be settled down.
You know,
Dr. Jared, what do you think? I mean, the workers, migrant workers who are migrating from big cities to smaller towns and villages, if
Yeah.
they get some kind of infection or contamination, or if they found positive, somewhere in between, so I mean, how they should take care of it, because you know that healthcare in those rural areas are not as good as what is in urban
Yes,
areas. What they should do, because they are migrating because they don't know what to do and they don't have work for like 60 days. So, what's your suggestion for that?
Yeah, it's a very alarming situation. So far, in our villages or remote a part of the country, we don't have this COVID-19, and those are the ones which are the main source of the agriculture
Yeah.
part. So when they get back to their respective cities or respective villages, and where the also the health resources are very limited, when they get infected, so that could be a very disastrous state, because no health infrastructure, no proper doctors, no proper nursing staff. So
Yeah.
that would be a alarming situation. But we should also think of that those are the migrant workers who are staying in the cities, in heavily densely cities, where they don't have getting food to eat, where they're
Yeah.
not getting the proper not maintaining the proper sanitization also, not
Yeah.
maintaining the social distance. In a single room, 10 people are staying together. So how they can maintain a social distance in a cities like metros like Delhi and Mumbai? So it's better they should get back to their respective state. Even if they get ill, it's the government duty that they should be shifted or they should be quarantined on priority basis. It's the
But
duty of the village.
what's your suggestion?
Yeah.
I mean, what kind of precautions, or what kind of things they will take care of, because they are migrating from east to west, north to south, and it's a long distance. So so suppose someone is migrating and he's virus free right now, but during that migration period,
Yeah.
during those days, they might got contaminated with
Infection. Yeah.
yeah. So how they can protect themselves? What are the best? Because we know that they will migrate. Government will help. They are going by trains, buses, and by walking and things like that. But what are the best practices they should follow so that they can avoid those, or maybe they can prevent themselves from the possible cures?
By any means, by the bus or by the train, by any means which they are traveling, they should maintain the social distance. Because by this time, whether it's the educated class of the Indian society or it's the the low socioeconomic class of the Indian society, all they know that what is the importance of this social distance, all what is the importance of the facial face mask, what is the importance of hand hygiene. So it's a good thing which I think the COVID has make us learn that we need to be little bit of aware of all those things while traveling. Also, they need to think that these things should not be you know compromised at any state. And
Yeah.
if they catch the virus during their transport or during the the traveling part, so when they get back to the respective city, they should be regular contact with the primary health center or community health center. They are the ones who take care of this initial part of the infection. Community health center is in direct contact with the medical colleges in the state or the big government hospitals, civil hospitals. So patients who are getting the symptoms, who are getting symptoms like severe acute respiratory infection, who are developing shortness of breath, fever, cough, they should be taken to the higher center. Those who are getting the mild symptoms, they should be managed at home at any any particular quarantine area in a village. So that's not a big issue. The issue is one has to be come forward from the respective villages, respective small towns to take care of those workers, because they are also the one who are taking care of us in terms of agriculture part.
No,
And Doctor, would you suggest that because you know that thousands and millions of people are using trains now in India to go from one place to the other. Do you think we should test them on railway stations? I mean, so that we can at least test them in masses and we can get to know who is having the COVID-19. Because with thermometer, it's difficult to just check that whether they have a flu or not.
So
But
you
and
know
also,
that
I would like to know that can we discuss about the Johnson Johnson new cheap mouth swabbing stick what we have we made in India so that we can do the mask checking? About that?
so yeah, I'll cover all these aspects.
Yeah.
One thing is that already we are doing the infrared thermometer scanning, but is a lot of patients who cannot be catched through this infrared thermometer. One thing. Second thing is, if you go by the conventional method, that is the RT-PCR of COVID testing, it will take another 24 hours, and also it's very costly. If you talk about all the patients who are asymptomatic or who doesn't have a who might be having mild symptoms, it's very
Yeah.
difficult to test all these patients and taking and awaiting for the report for the next 24 hours. Yes, the third part which you talk about, the new test from the oral or the nasal secretion, but I think that will take certain time to come to the market. One more important test which has been developed by the ICMR and the National Institute of Virology, Pune, about the serology ELISA test, and that can easily pick up the person who have been exposed with the COVID-19 by detecting IgG levels.
Okay.
So that can be utilized because that is the point of care test. Any patient, any patient or any person who is arriving in the railway station, arriving in the hospital, in the bus stand, 1 hour before that, they can go for testing. If the report comes negative, they can good to go. If the
Yeah.
report comes positive, that depends. That we say IgM level or IgG level. If IgM level, then they need to be quarantined for certain period of time. IgG level, yes, again they should be assumed to be immune because they already have undergone the COVID, containment part. One more important thing is that there is a new concept which has come up: the getting of COVID inside my body and development of IgG. It's not equivalent to the neutralizing antibodies. So if I have the IgG, it doesn't mean that I am immune to COVID-19 because IgG is not equivalent to neutralizing antibodies because neutralizing antibodies are also IgG. So there is a chance that I may get a reinfection. I may get, reactivation of the disease. So these things are still matter of debate. We are, still 5 or 4 5 months old with this COVID-19, and many new things has to be come up. You can take the example of HIV. We are more than 30 years, 40 years old with this HIV virus, and still we are struggling with the HIV virus. Similarly, with the hepatitis C virus, we don't have vaccine so far. So there are the certain things I think which we need to take care that all the tests should be analyzed with a critical appraisal.
Great.
No, I think
You were saying something in between?
So, Dr. Jatin.
Yeah.
So, the WHO, they're rushing to get rapid approval for the coronavirus vaccine. What is your opinion on that?
As we know that the WHO is also under the pressure. All the pharmaceutical companies, WHO, which is the main body, which is to be taken care by all the countries of the world, of basically main the communicable disease, also the non-communicable disease. So they have a lot of pressure to get with any vaccine so that this virus can be contained in a better way. As we know that almost more than 80,000 deaths in the United States. In India, it's more than 3,000 deaths already been reported. Even in Italy, UK, more than 25,000 deaths are already there. So there's a lot of pressure over World Health Organization. So they are in the plan so that a new and effective vaccine can be developed, which can be utilized in further expansion of this virus. But as we all know that there are a lot of competition is going on between all these pharmaceutical companies, and still no one has come up to enter into the phase 3. Most of them are going in the phase 1, phase 2 trials only. When it enters into the phase 3 and then into the public domain, then only we can know whether this vaccine is effective in our setup or not. So far, we don't have any effective vaccine. Yes, definitely in the animals, there are certain vaccines which have proven to be development of neutralizing antibodies, good neutralizing antibodies. But if we talk about the human context, we don't have right now any data.
That's a problem. I don't think vaccine is solution, because by the time it's developed, 18 months later, the virus has already mutated.
Yeah.
We know that there's already at least 3 strains. So another problem is, believe it or not, there's not one vaccine made in the US. They've done actually safety studies. Like autism is on the rise, but so is, mandated vaccinations in pregnant women and their babies. So if you actually look at what are the ingredients in a vaccine, thimerosal, which is formaldehyde, mercury, aluminum, and guess what? Aborted fetus parts, because that's what they culture it in. And they add these heavy metals and formaldehyde. They're called adjuvants to activate, right? To activate the vaccine. But what is that doing to your body, your health? You're actually creating more autoimmune disease for a lifetime. Like I know that the Bill Gates Foundation, they were giving polio vaccine injections in India and Africa, but many children developed polio because of that vaccine, and hundreds of children died. You guys are aware of that, right? Yeah, so I don't really agree that Bill Gates wants to mandate this coronavirus vaccine for every woman, children, and baby, and pregnant women. I mean, it's ridiculous. How can one vaccine be universal to an adult and an infant? Doesn't make sense. And they want to do rapid approval without any safety studies, no animal studies, just jump into human trials. I think it's a last resort if that, but people should have a choice if they're going to put that in their body, because the bottom line is if you have a strong immune system, you will fight off the virus.
Can I jump in the middle of this for a second? What happened to using the plasma transfusions from recovered patients to patients that need treatment? Is that not a valid solution right now?
Yeah, actually, what happened is there has been studies going on, and it has been seen that patients who have been recovered fully with this COVID-19 also, they have not developed the large number of antibody titers in the body. And there are certain patients who are getting sick even with this COVID-19 or being succumb to this illness of this COVID-19. They are getting the large number of antibody titers. So there is a lot of variation is going on with in terms of antibodies development. If we talk about this COVID-19, so patients who are healthy, who have developed asymptomatic infection from COVID-19, it doesn't mean that they have the large number of antibody titers. They might be having the good immunity, and good immunity not doesn't mean antibody. It could be because of the innate immunity. That is the first line of defense. And innate immunity is always cell dependent. It's not antibody dependent. It's a T cell dependent. So in the the conventional plasma therapy, we are transfusing only the antibody part, not the cells. So
that being said,
yeah,
T cells.
Yeah.
What is
Yeah,
rich
T
in T cells? Umbilical cord blood stem cells, right?
So that's come the role of yours, that in your cord blood or T therapy of the transfusion, you are taking the T cell help. In stem cell therapy, you're taking the T cell help.
Exactly.
Yeah. Similarly, with the patients who are healthy, who are young, who are healthy, who are without any comorbidity, they're the innate immunity, the T cells, which are playing the major role, not the antibody part. Because development of antibody again takes almost a week to tackle this virus, and by the week, patient is almost afebrile. Innate immunity has already played the role. Yeah.
Right.
Yeah, so there's a lot of FDA rapid approval, umbilical cord, birth tissue, placenta studies, natural killer cell studies for coronavirus. I think that's going to be the solution if you are infected and you're older, because the older you are, the less your stem cell count, the less T cells, the less natural killer cells, and so they may need the umbilical cord stem cells from a donor. Because the umbilical cord is taken right after the baby's born. So they're day 0 old, they're young, more vibrant, they have a higher count, they're more regenerative, more reparative, more immunomodulatory. So I think when you come out of this, we're gonna see a lot more use and acceptance and approval with these stem cell therapies. Now, talking about the UV light, that's what Trump was talking about a few weeks ago. He said, we got to get UV light into the body through the skin with some type of disinfectant. He didn't say Lysol or bleach. The media totally turned it around.
They
what he was talking about is things like methylene blue. And that's a disinfectant they've used for years. It used to be in mouthwash, the blue. And the virus goes in the mucosa of your mouth or your nose, eyes or ears. So if you put methylene blue in your mouth or your nose, it will kill the colony of the virus if it's in there and prevent it going down the throat. Now, after you paint your mouth or nose with the methylene blue, and it is blue, right? Then there's a UV mouthpiece. And there's diodes in there with bright purple or blue UV light at 400 nanometers around. And that will activate the methylene blue. We know UV light it kills pathogens like viruses and bacteria. And there's actually a UV light laser type device you put in your nose. So you take swabs of methylene blue in your nose, put the nasal light to activate the methylene blue, kill the viruses, and the light has other health benefits like, again, nitric oxide production. It will irradiate your blood. So there's actually a laser watch you put on your radial artery, and because the blood circulates through your body every several minutes, that UV light will irradiate your blood. So yeah, I think this is the answer, just to use what's available to us in nature, light. Now, methylene blue is a chemical, but with controlled dosages doesn't have the side effects like most pharmaceuticals. So this is the study they're doing in Canada, methylene blue. I think they're doing theirs nasally, but I belong to Academy of Photodiamide Oxidative Stress Physicians. We feel the mouth is probably better than the nose because most of the pathogens will go in there. And, you know, in reality, it goes to the nasal pharynx, down the trachea to the lung. We want to stop it from going down the throat. So, yeah. I will show you a picture of that laser mouthpiece. I'll make a presentation for tomorrow.
Dr. Philip, my question to you is, don't you think that the UV rays on the human body could be mutagenic? That could be potential threat to the later on development of cancer or any kind of tumor in the later half of the life. You can get rid of this virus by putting this UV rays directly on your nose or over your oral cavity, which are the potential routes of transmission. But what about the cancer part? I mean, we know that the UV rays are potentially harmful. That is why we use them, at the isolated room for our, clearing, disinfecting our mask, our other equipments, where no person accessibility should be there when the UV light is on. Once we have switch off the UV light, then only you can enter that room. This is what we have been taught from our medical school days. They are the potential teratogenic one, potential mutagenic one. So this should be avoided on routine practice to the human body.
Well, if a woman has cancer cells in her breast, and you expose that to UV light, will it throw fuel, give fuel to the fire to make that cancer grow faster? We don't know. What I can say is, like a lot of people say, oh, if you lie in the sun, the UV light will cause skin cancer. That may be true if you're overexposed. You have too much, burning, right? And then higher chance of cancer. When the reality is, a lot of people are in the sun all the time. They're actually protected by cancer because they have more vitamin D3 production, and you get melanin, and then melanin protects you from the harmful rays. So you have to have controlled doses of UV light, right? And another thing is, a lot of these people get skin cancer from the sun is because they don't have enough antioxidants in their diet. So you need more antioxidants, and that will prevent the cancer rates. So again, the vitamin D3 is essential for immune system to fight the cancer, because we have cancer cells all the time, but not everyone gets cancer, the overgrowth, right?
After again the round, we are again back to the,
orally or nasally. I mean, the chance of cancer, I would say it's probably nil. I would say it's going to decrease your chances of cancer just because it's killing pathogens and it's enhancing your immune system. I mean, you're going to get more cancer from more exposure to autoimmune disease, from pharmaceuticals, from all these the vaccines which stress your immune system. So, and of course, stress, unhealthy diet. Other than that, so it's a small risk to take for a non-invasive way, to kill the virus or even prevent it. So, yeah.
Doctor, you have more knowledge about the cancer in the patient, but we have seen cases in Australia, especially the skin cancer is compared to the rest of the world, they have more skin cancers. Is it because of the sun rays or is it because of something else? Because they claim that it's because of sun rays.
I think most likely because the ozone layer, the ozone is the surrounding, it's like a cloud around the earth, and that filters out the harmful UV rays. But because of the CO2 exhaustion in all our cars and pollution, the ozone layer is thinner. So theoretically, the more harmful UV rays from the sun gets through. But no, overexposure, if you're not balancing it with correct antioxidants like beta carotene, vitamin A, vitamin C, vitamin D3, which you're going to get from the sun, then you probably have a higher incidence. Plus, most Australians have Northern European or English ancestry. They don't have as much melanin as like an African or people with more pigmentation who naturally can, block the harmful rays. I think it has more to do with epigenetics, the skin tone, their lifestyle, their diet, than just blaming it on the sun. I think controlled exposures is the answer. Yeah. So it's not get sunlight or not. It's like get some, but not too much, right?
So I think the Dr. Yu is absolutely right. At the poles and temperate regions, there is certain depletion of the ozone layer, and that could be a potential threat for the development of skin malignancies, which we usually see in the Canadian population and then in the Australian population because of the depletion of this ozone layer.
Like, I'm not a big fan of the suntan lotion because the chemicals, the parabens are very toxic. It's better just to go out in the sun maybe 5 minutes, the next day 10, build up a tolerance, right? And that's the best way to protect yourself. If most people, they go on a cruise, they haven't been to sun for years, then they sunbathe and sunburn, that's when you get in problems. So yeah. Mm-hmm.
No, I agree with you on that too, because I know so many people who've had skin cancer from sun, and I think you're right. I think it's a matter of balance. Don't overexpose yourself the first day because you burn your skin, right? And your skin's telling you, whoa, that's too much. Your body's telling you that's too much. Yeah. And so many people have done that to themselves. I think each person's different. Your pigment's different. Your ability to absorb it is different. But I agree too. All of those chemicals, they've never done anything for me to begin with except burn my skin. So a lot of times I'll put them on my skin, and it's just like, why did I do that? It just, except that we were told to do it. But it
also sunglasses. You think that protects your eyes? Actually, when you wear sunglasses, your pupils dilate more, and you let more of the harmful UV light in. So you should really minimize your sunglass. You just wear a hat to block the sun.
And there are all of these good practices that people just aren't aware of because they're told by media or by advertising, this is what's better for you, because the advertising is trying to sell something. Whereas, we kind of know better. Like when I was growing up, I never burned. Never. I'm partial Native American Indian, but my skin is more of my mother type than my father's. But I never burned. But also, and my parents never put me any chemical on me growing up. In fact, if they were worse, they'd put baby oil on us. Here, you need more tan. Put more baby oil on you, and. But I never burned. And I pray to God that I don't get skin cancer because of all of that. As I get older, I do better. Like you said, I go out a little bit every day. Everybody says, how did you get so brown? It was just 15 minutes every day. If people call me after the show, they're going to hear birds because I do exactly what Dr. Yu does. I've seen him go out and he'll talk to us from outside. I go outside. 15 minutes. I find a place where I'm in the sun. I open my mouth. I'm scared of flies, but I open the mouth and I just absorb it. And I think that there's a healthy balance of everything, especially if we're thinking about killing diseases. And I found this picture of something because we're all talking about this new UV, and I've dabbled with UV to help clean water, right? It's in one of our filter systems that we use to clean water. But I'm going to show you something I was joking about. I was joking. But I think people are going to take this serious. But I mean, this is a laser. We know that teeth whiteners kill diseases, right? In fact, teeth whiteners were found basically because they were cleaning people's gums, infected gums. And they realized all the people's gums that we cleaned with this chemical, their teeth are brilliant white. So why don't we sell it as a whitener, not just as cleaning your mouth and the infections in the gums? But I don't know about this particular UV light. I don't know if it's strong enough. But if we're talking about doing something daily treatment to help kill. It doesn't mean it's going to kill all of them, but to put in the mouth, right? I've always felt like if the whitener gels were originated to clean the infections in gums to begin with, then they've certainly got to be cleaning my gums if I'm using them to white my teeth, right? So I think there's an answer out there. We just can't quit looking. Building the immunity system, social distancing for now. Right now, I agree with Dr. Jayton. We got to address it as it is and quit spreading it. We just have to stop spreading it. Good practices, and then build our immunity system and learn to live with it.
Well,
traveling not an option, I don't think getting on a train
if this thing actually exists, because I don't think the coronavirus, the SARS-CoV-2 has actually been isolated, as far as I know. Like, I want to see this thing under electron microscope. I want to see the spike just to know it exists, because we know that when the media puts fear in people, you release stress hormones, right?
Yeah.
And that could mimic a viral infection. You release toxins. You release exosomes. There's good exosomes and bad exosomes. You can release the bad exosomes, which release toxins, which affect your lungs, because did you see that video in Senegal? They tested papaya fruit. They tested an animal with the antibody test, and the fruit was positive and the animal was negative. So should we quarantine the papaya fruit and goats? So he's like, man, does this thing even exist? You know what I'm saying?
Well, I think it does. I wish.
Dr. Jatine, would you like to see the virus isolated with your own eyes? See it under electron microscope. Just for validation. Yes, this does exist.
He probably has. He probably seen it. Have you? I mean, it would be nice if they did that and showed it to the world, like did a video.
Yeah, because
the world,
data could be manipulated. Statistics, like we're here in the U.S., doctors being told, "Oh, that patient died of a heart attack. Let's swab his nose. Oh, he has coronavirus. He died of coronavirus. No, he didn't. He died of a heart attack. He happened to be positive for coronavirus." So I don't think it's accurate. Yeah.
Well, no, the numbers are not accurate, but actually I'm told that DOA, they're not testing, right? They're not wasting the test kits. So actually we don't know if people actually died of COVID or not, because they've got so many DOAs and bodies, but they were not going to waste the test kits. So the count is way off either way. And I was told that if they're in the hospital and they tested positive, then they died, then odds are they're going to count that as a COVID death because they tested positive. Even if they'd had heart diseases and diabetes, it's apparent that the COVID probably pushed them over the edge. But the media has played so much political hype on the numbers. It's not fair to the doctors. It's not fair to the researchers who are out there working their tails off to just, it doesn't matter. We got a problem. Let's clean it up. Get it fixed where people are not working 24/7 and feeling like they need to kill themselves because they're not making any headway. And that's what's happening. And a lot of doctors are becoming depressed over this as well. So that, but the problem is that people are not taking it serious. They're like, they're becoming the doubters, so what that you've worked 24 hours and saw 10 people die on your watch, I want to get out and live again. Well, the doctor wants to go home and get rest eventually, and they're not, because why? And we've got some areas of the country that have not seen one incident. I got to question that. Where Lynn is, Lynn's not on yet. I think he usually comes on around 1:30. Lynn is in Pennsylvania, I think, and not one incident.
Yeah, but I'm sorry. I have this saying, if there were no news, there'd be no virus. It would be business as usual. Yeah, some people would die of viruses, but people die every day of influenza virus,
But not at this rate.
We don't shut down the whole world, Yeah.
But they won't die at this rate. And like we said, that this is contagious for 14 days. the problem wasn't about whether you got sick with it. The problem was, could the hospitals maintain the volume of people who needed?
Well, here's the problem with that. So the media putting fear in people. Everyone's a hypochondriac. So, oh, I have a cough. I have a fever, sore throat, I better go to the emergency room.
Right, that's bad.
Flooding it. That's a problem. Now, when I get a cold, guess what? I eat soup. I get vitamin C. I stay at home and rest. I have liquids. I let the fever take its course because the high temperature will kill the pathogen. You don't go to the emergency room. And so it's not that people are getting infected by the coronavirus and overflowing the urgent care and emergency room. It was people who didn't need to go because they're hypochondriacs, because the media is like, oh, I have this symptom, I better go. So that's a problem.
And that's where I think that if we could get to just daily testing, even though we know tests are probably 85% accurate, but if you do it daily, eventually you'll isolate the situation, but you're going to reduce that panic of hypochondriacs.
Yeah, so here's hey, so Dr. Jati, here's the test.
So you got it.
Yeah, so IgG and IgM.
He likes this one.
Yes, it's 10 minutes, 1 prick of blood. The solution.
Dual kit.
Yeah, we mail this to everyone in the world, and through a Zoom consultation, we walk them through it. A monkey could do it. 10 minutes, positive, negative, no brainer.
The thing is one region, of course, but it's like, I think it's, it's 25 in there. It would be nice if there were 30, because then you could get a test kit for a whole month for each person, right?
Well, this company, every company's different.
Yeah.
I think we only have 10 kits, but there's companies that have 30 or 40.
But I'm just saying, it's very cost effective compared to sending out a stimulus check of $1,200. And we can test people, say, for $25, $30 a month. Say $30 a month. You're testing people every day, just like you would diabetes. It's so simple.
Oh, cholesterol, yeah, you test it every day. Yeah.
So
well,
the
president tests every day. So why not? And it's just like checking your diabetes. Am I sick? And maybe it was wrong yesterday, but if you're doing it every day, you'll catch it. You'll get early detection somewhere, and you'll get enough. But this is an interesting fact that we've kind of discovered through our show. Is it seems like the 2 places that does not have mail delivery has no COVID.
You see? Because they don't get the news.
They have mail delivery. They have news.
We got a second wave in infections coming.
No, they have
5% Americans are going to die. It's like, no, they have no stress. They're healthier. They're getting the sunshine. Yeah.
But think about it. No postal delivery. This kind of came to me as we were having the conversations this week, and Lynn said he didn't have any, and then I went and looked at the some other places that have no home postal delivery. They don't have the infections.
Yeah.
Kim, I'll tell you what's happening in India. Before I comment on $1,200, that $1,200 is not for COVID. It may be for an election vote.
Oh yeah.
Because the election vote. And also when we talk about postal delivery, in India we have we are 1.3 billion. So we are using post office to deliver those currency or money to the required person. Wow.
So I get my $1,200 from him, right?
Wow.
And then I get a letter.
Qualified. Wow.
So wait. We must.
Wrong time. So what I was saying, Doctor, use that we use postal services to deliver the currency note to the rural India, because a lot of people don't have the access to the bank right now because of the lockdown. And also a lot of rural places, they don't have banks. So postal boys and postal army, they are utilizing themselves to distribute the currency to the person so that they have the cash and they can utilize at the time of pandemic. That's how we use postal. But the concern is that, whenever you have a physical contact, there might be a problem. But we are trying to prevent and figure it out how we can test those people on regular basis so that we can't carry and spread that contamination to those areas which are naturally secure and safe. They are out of the world. They are not like in Delhi or like any other metros in India with a lot of pollution and a lot of people surrounding and all those things. But our concern is that if those people will get viruses, it's difficult to survive and it's difficult to save life in India. So our whole task force is just to block the virus within those contamination areas, so that it won't go further and people have a better life, because it's been more than 2 months. But now we have limited red zones, but those red zones are extended their lockdown, so that we can't spread this thing. But
yeah, no, the problem. So India, like the US, they have a stimulus check. Everyone gets like financial help, right? No, okay.
No.
But here's the problem. They're saying people have to wear a mask, and if the mask is sterile, that's fine. But if you don't sterilize it, you're breathing in your own pathogens. You'll be less healthy. You're not getting enough oxygen. You're breathing in more, like carbon dioxide waste, right? So you can disinfect your mask with spraying hydrogen peroxide, leaving it in the sun, but the average person who are lower class, they're not educated. They don't have hydrogen peroxide, right? So it's very hard to educate people. But in many ways, they're more healthier than us because they fast. They get less calories. Fasting increases your natural killer cells.
Yeah.
They're walking barefoot on the ground. That's healthy grounding. You get positive electrons in your body, and they get sunlight. And they probably can't afford these rich foods. So if they're getting basic nutrition, some protein, some fruits, some veggies, we know too much calories is not good. In many ways, the poor populations are probably healthier than people in the upper class in some ways.
I'll give an example. I think Dr. Jatin would agree. All our OPDs in India, they start from at 9 o'clock, maybe earlier than that, and they finish up at 4:35, 6 o'clock. By the time they finish up, there is no sunlight. So I think a lot of doctors are taking a lot of vitamins and medicine just because they don't have sunlight. But Dr. Jatin, do you think we can have OPDs in the ground, or maybe with sunlight coming up, and then we can have those OPDs?
Yeah, that can only be seen when we have the kind of when we go for the camps, when we have camps outside our hospitals. That's the only occasion we have the exposure from the sun. Unless and until otherwise, we have to be sitting in the single room starting from 8 a.m. in the morning until 6 p.m. in the evening. So by that time, sun comes and sun goes. Then only we get out of the
But Doctor, can you see? Can we have an open field hospital where there's a big field and there are small tents and doctors are taking the OPDs?
I think with the COVID-19 as this unfolds, Maharashtra, I think I have seen yesterday in the news that they have made in the Nagpur city, they have made a large 5,000 bedded hospital in the open ground area, and where we can have the good sunlight, good air exchanges per hour. Because good air exchange is very important, and a good distance between each bed, almost around more than 6 feet between each bed. So that's I think they have 5,000 capacities of the beds they have. I think they have made it. I think these are the.
Yes, Doctor.
Yeah.
I said distance we started with 1 feet, 2 feet, 3 feet, 4 feet, 2 meter, and now we are talking about 6 feet.
Yeah,
I think that's
a hoop dress. That's what I want. I'm going to put my hoop dress on. But no, I did want to share with you guys. This is what Trump sent me. He gives me that, and he's asking me to send him $1,200 to support his campaign because he made sure that we got a paycheck of $1,200. So he wants $1,200 back from me. But hey,
it's a give and take. It's a give and take.
And he sent it with the return paid for envelope, right? So,
wow.
So my thoughts were, I
don't know. I mean, maybe this envelope can become a mask. Is it possible to have a mask of this envelope?
It's paper. I don't like paper masks. But what I will tell you is, somebody told me to stuff it full of junk and email it, mail it back to him. Here's the thing about him: he doesn't understand. If he had sent me a mask with his name on it, I would have worn it. I probably would have said, hey, I like this guy now because he cares about me. but he didn't. He sent me this asking me for money, a keychain asking me for money. I want somebody who cares enough about me. If he sent me a $10 test kit, because he just sent me a $1,200 check, right? Yeah, if he just sent me 10 of these or a pack of test kits and said, would you mind testing? I would probably send him a donation for sending me a test kit. If he sent test kits to everyone, I would probably say, hey, here's $10 or here's $50. Thank you very much. But
Tim, I got these mask pack of masks from Max Hospital Sake, and it costs around $3 or maybe $3.50 with 25 pieces.
Oh my God!
Wow, and you know,
and then I think the printing of that envelope and things like that cost more than this mask.
No, so it's a pre-stamped envelope, so of course it's going to cost money going back. But their idea is they sent me this little plastic thing that I hate because it goes onto a keychain, which, by the way, people don't know, but I've only driven once or twice since COVID, so I don't even use a keychain anymore. Most people don't have a keychain because they have a fob now, right? But I was just irritated. I was like, send me a test kit. You get tested every day. Send me a mask. Maybe I would vote for you and support you, but I'm not sending money to somebody who just sends me something like that. I'm just not going to do it. What I want is somebody to put money to research. If he sent me a thing saying, you know what, Kim, I just put $5 million into the infectious disease department to research COVID. Hopefully I would say, here's some money. And you got my vote, but that's not what he's doing. They're going to be mudslinging here real soon. I'm going to hate America in about 2 months. This will not be a fun place to live because people, people will be mudslinging campaigns. But the thing is that none of this should be about political, right? But we need to be putting our resources and our money back into getting us on our feet, back to the economic situation. I hate to see people go when they have to leave, but anyway, we'll see you tomorrow.
Yes.
Tomorrow?
Tomorrow's Saturday.
Yeah, tomorrow's Stem Cell Saturday.
Yeah.
We're promoting that. So so people are looking forward to stem cell, and I've got Noah coming in and doing a science class with kids right after you. So
okay, I'll see you tomorrow.
See you tomorrow. Bye.
Okay, bye.
But anyway, so let's talk about traveling a little bit because this is your background as well. What do we talked about getting on trains and buses. I'm scared. I don't want to get into a booth and get sprayed. I don't want to get around a lot of people, but you can't social distance on a train. You can't social distance on a bus. I don't know what your transportation systems are like, but I feel like people could hang out the windows if they would let them. I mean, it's, we cram in so tight. How are they going to control that in any transportation?
Yeah, I think I have the opportunity to travel from Penn Station, New York, from Amtrak down to the DC. I think 4 or 5 months back only. So the trains are almost similar, but you have it and we have it in India. The only thing is the kind of difference between the speed. You have better speed in United States as compared to our country. But if we talk about the seating arrangement, recently our Delhi government has come up with the plan that soon we will be starting with our Delhi metro. It's almost this similar thing which we have the local metros in our New York or New Jersey like cities, but they are doing it. They are posting a poster that this seat should not be taken by anyone. One seat should be taken, and again this seat should be again to be vacant, and another seat should be taken. So this is how social distancing need to be maintained. On the contrary, if we talk about the station, train doesn't need to travel all these stations. There has to be certain major stations which trains to be captured. And another thing is that in the station also there is limited entry should be there, and that too entry with the particular time. Like if it's 10:30, only 50 people will be going to allow per station. With 11:30, another 50 people will be allowed on per station. We cannot allow huge crowd getting into the one station and then letting compromising our social distancing. This is how the Delhi Metro is planning to do it. If we talk about the Indian Railway, they are already maintaining the social distance, providing the soap and water into the uh, train, providing the sanitizing portion part into the train, as well as maintaining the social distancing not in the station but as well as in the trains also.
No, I think these are just going to be practices, and again, we're going to have to learn to live among it. Turn it into what becomes our common cold, right? We build our immunity system. Hopefully, the virus itself will mutate down rather than up, and we can learn to live. But I think these are practices we need to get to anyway. I think, reduction of mass, where everybody's packed in when we're traveling. I think we just need to reduce that, maybe only 25 people per car. When you get into the subway, it's more like 125 people in a car. And it gets very, very scary, even without the COVID. It used to make me nervous without. So I think we just, I don't know how they're going to control that here. I'm glad to hear that you're talking about it there. I think it's still an issue here because people don't know how to behave themselves in America. Some people do, a lot of people don't. So, I think, and I'm interested in seeing what our outcome is going to be, considering the fact we already kind of opened up. And we've had Supreme Court rulings where they have told whole states that they don't have to do stay at home or shelter in place. So the Supreme Court ruling has taken the right away from the governor so that he cannot tell people you need to stay home for the benefit of preventing the spread of this disease. So I'm interested in seeing our results from this action. But, you guys have handled it pretty well.
I think as far as my perspective is concerned, staying at home at certain point was, I think it was absolutely correct. I think the first two lockdown which India has already gone through, but now if we see that the data that even during the lockdown, there is more than 10 times rise in the patients. How they have grown so high? I mean,
nobody's locking down. They're not locking down.
Yeah, it means one thing is that our locking down is not fully compatible, or it could be that the disease is so contagious, and even with the effective lockdown, we are not able to curb the disease. So it's better the youth of the country, the young population, has to be little bit get out of their houses, keep continuing our routine or daily works, and there is nothing known as taboo with this COVID-19, but the taboo part and the fear part which the people have think in their mind, and also the phobia. If we get out of my home, then definitely the virus will catch me. It will only catch you if you don't maintain the social distance, you don't wash your hands, if you don't take care of your clothes also. If I'll go to the hospital and after coming back to the hospital I don't wash my clothes, I don't dip into the hot water, then there could be a chance that I can get the virus.
And I think you're right. I think that the risk is always there. I might not have had it. It could have been a serious infection, but for about 6 weeks almost, I was sick. But it was up and down, right? Up and down, and to the point that my whole side of my face swelled up really bad. And I finally was able to get it under control, but it was 6 weeks, and now I've got a strong fatigue. I will probably go get tested eventually to see if I had it, but it could have been just any infection, but it was very painful. It was very painful to breathe. It felt very, very painful. But I think that even if you stay at home, because I've locked down 2 weeks before the US lockdown, but food was still coming to my house, right? Things were still coming to my, so yeah. I think you're right. I think no matter what precautions we take, we're still open to the infection. And, you know, I think that, again, build your immunity, practice good, healthy, you know, practices, but building our immunity is going to be the most important. But now that we're all poor and broke and haven't worked and no money, that's going to be hard to do because it's expensive to eat healthy food, right? It's very, very expensive to eat healthy. And most people eat junk food. Yes.
Yeah, one very important thing which I like to highlight over here. We the human beings, we assume that this whole world belongs to us. Why don't we think in a opposite way that this is the world of viruses, this is the world of bacteria. We are interfering their life. They're already, yeah, they're yeah, they're outnumbered. They're more than outnumbered as we talk about the human population, and we are disrupting the natural environment. We are disrupting the reservoirs, the sea, the forest, everything. We are disrupting it. That is why they are leaving their initial, host and coming into the new host like human beings. So
I agree. I think you're absolutely right. Why is it our world and not theirs? And actually, you know, this might be Mother Nature taking back what belongs to her in a very vicious way. We don't know. Yeah. I mean, we could have unleashed this on ourselves, but I agree with you. I believe the viruses are living. I believe that they are, like you said, they're a host looking for a host to live into. And they might be smarter than us. Who knows?
Yeah. And very important point
of our bad habits, basically, Dr. Ahuja. I mean, because we human beings, we have a lot of good habits and we have a lot of bad habits, and we tend to eat a lot of things which we don't have to eat. And I think there might be something which is wrong we are doing, and that's why we have so much of viruses and disease coming up every now and then.
Yeah. So if we talk about the Indian context specifically, so look at the benefits of the look at the benefits of the social distancing. If we talk about the metro cities, we'll be having less number of the influenza cases. We'll be having the less number of tuberculosis cases, less overcrowding. So I think the overall mortality, if we look at with the social distancing, with the using of face mask, all this also will come down to very, very low level.
No, I think you're right, and I think we just need to respect what our Earth is, good or bad. It's not our Earth. You're right. Earth is everything. You know, we try to take the animals away from it. We try to own something that we really can't own.
We need to understand. Yeah, we need to understand. We all are prepaid SIM cards. We all have prepaid SIM cards. We have a certain duration of activity, maybe 30 years, maybe 60 years, maybe 80 years. And once we cover those prepaid activity, we need to get back to our native place.
Yeah. And I think if we approached it that way, maybe respecting each other would come back to being a norm. But respecting that virus, it's like I don't like cockroaches, right? I can't stand them, but they've been here longer than us, right?
Yeah.
Right? This is their earth. This is what I keep telling myself. This is or it's his earth, not mine. He was here before me, and he survived. The cockroaches have survived many changes of earth. I think that's what we need to be studying. I mean, the cockroaches might be spreading the virus. We don't know. But, and the reason why I bring up the cockroaches is because I just read a book on bugs, and I'm always reading something, right? And National Geographic had a great book on the extinction of bugs. But the one bug that hasn't extinct, probably never will, he'll probably take over the moon if we've taken it to the moon, is the cockroach. Why does it survive? That's what we need to be researching. And I think the coronavirus, I think you're right. I think it owns this earth. We need to say, okay, here. And like a tick, you have to look at it like a tick. It needs a host to live in, right? That's why it goes inside us, just like a vampire movie or something, right? But a tick does the same thing, right? We see the tick usually, we can take it off. We can't see the virus and take it out. But I agree with you. That's probably the best vision I've had of how to deal with this is that it owns the earth. We don't. And
Yeah, they're not the new customers. They're not the new customers to our, home or our land. They might be already present in one or another form. And since we are exploring the new things, we are exploring the new land and cut deforestation, we are doing it. So they might already there in the, dead forest, and we are entering their property. So everybody is talking about where the hell this virus has come over here in this land, on this land. They're already there, my dear friends. They're already there. We are entering their native places. So it's a high time. We should think that since we talk about solidarity in this management of the COVID disease, we should also talk about the solidarity in viruses also.
In fact, I think they are exploring the world now because we have been exploring the world since long, and now it's time to explore the world. That's what they are doing. They are looking for new hosts. They are looking for new gateways because we, as human beings, trying to capture the whole world. We want to buy the land. We want to build big houses, and we want to. Yes.
We want to make tunnels. We want to explore the sea, deep sea. We want to explore the sky. We want to go everywhere. Now we are starting exploring the other planets also. So where will they go? Where will they go? They will come to our houses only. But they are doing it. So I think now it's the high time we should start accepting them. That definitely they are going to stay with us. The only thing is we need to be a little bit cautious, and that's how life goes. Already, we have a number of organisms in our environment. Even if we inhale, we are inhaling a number of organisms. But we're not talking about those organisms. We're talking about COVID only, because COVID is something new to us. It's new to our house. So if once we have another family member entering in our house apart from the COVID, then we talk about that person. We forgot about the tuberculosis, we forgot about the COVID, we forgot about the influenza. So now I think we should accept it, and we start living with this only.
No, I agree. I agree.
I think that's the way forward, and I think we have to accept it and we plan life accordingly. And that is the way forward, and that is all. If we stay united, if we stay together, if we think about one world, and if we share the best practices, I think we can fight with it because all other viruses which we have discovered and which we know, they are already in our society right now. It's not that they have been vanished. It's just that we have vaccines and we have things and medication to overcome those things basically. So I think same goes with COVID, but it's just a matter of time that we have to just stay calm and stay united and stay monitored what's going on, and then just do the right preventions and try to secure and try to live a good life.
When I just don't think there's a miracle cure. I really don't. And I think we need to stop doing rapid pushing of vaccines. I think we need to properly research them. I still think if we can use some sort of plasma, that's fine. If not, treat the symptoms, right? Get you through it just like you would a cold. And if it gets too bad, get you to the hospital and treat you. I just think just control it. But I think I'm scared of these pushes for drugs that haven't been tested. I don't want something put in my body that they think, oh, this is going to work, and it doesn't. That's the biggest false illusion. It's kind of like when everybody was touting, oh, hydroxyquine is the answer, or Revestropor. Actually, no, there was just treating the symptoms. That's all that's been the answer. And I think that that's what we're going to find in the future is there's not a 100% answer. They're finding out so much about this that they told us wrong in the beginning.
Problem is we are thinking in terms of how we can defeat this virus. Why don't we think that we should
live with it?
The virus, virus should stay of its own, and we should be staying at their own place. We should not fight with each other. Okay. It's time that virus, we get immune toward this virus. We should increase our immunity, and if probable in the future, then we should be having the good vaccination. But don't think that we should be going to defeat this virus. Defeating, have we ever defeated the HIV virus? Have we ever defeated the hepatitis C virus? Have we ever defeated the influenza virus? They're still with us. So why don't we think that we need to defeat this virus? We need to defeat this pandemic. That's the only thing I see.
Exactly.
I think we have to minimize the virus spread with medication and also try to prevent themselves. That is what we need to do, because prevention is always better than cure, and that is what we have to do right now, because vaccine is still far, and we have to be strong, and we don't have to be panicked when someone is having COVID, because I mean we can still overcome the situation, and I think we are increasing our mortality rate as well. So I think we are in a good hand.
But I think that people just so here's the problem. See, when people get sick, they should stay home. Just like you're saying, if you're sick, stay home, get through it, get past it. But the problem is people that I know so many people who go to work sick with a cold. When they go to work with a cold, what do they do? Well, it's just a cold. Who gives, some people can die from it. Some people can die from the flu. But go to work sick, you're going to spread it. So here's the problem. The problem is you got COVID that spreads like the bejeebies, right? Because you'll have it asymmetric anyway. So by the time you get the symptoms, you're probably really, very, very sick. They're still going to go to work sick. Just like we shut down here in North Carolina. On the week we shut down, they allowed the government offices to stay open. It was 500 people in the building, okay? Essential employees only. One person walked in with fever. He had okay, so we're shut down for pandemic as it is, but he shouldn't have come to work with a fever. But, oh no, I can't miss my job. I need my paycheck. So pandemic situation to begin with, you should not come in with a fever, but even if you were, so he would have spread whatever he had anyway. Sad thing was he had COVID. He tested positive for COVID. So not everybody who got sick with a fever tested positive with COVID. My nephew got really, really sick. Finally, he couldn't take it anymore because he couldn't breathe. He thought, I must have it. So he went to get tested. They ended up finding out that he had a really bad case of the flu and pneumonia. It wasn't COVID. But he tested, negative for this and this, and they finally realized, no, you have a really bad. So, just precaution. But you know what? He shouldn't have been going to work. He had a fever. He shouldn't have been going to work, because you make yourself sicker and you make everyone else sick. So my thing is the reason why that they probably hit panic mode is people don't stay home when they're sick, right? People went to a concert. They went ahead and let a concert happen here in North Carolina. After they shut down all events, they still allowed a concert. Somebody went sick because they paid a fortune for that ticket. Right? Now, if the governor said the concert was closed down, they would have been reimbursed for the ticket. But he didn't do that. He closed every event down, all sports. One person came in with a fever and they spread it and they tested positive. So the problem isn't anything other than people don't do what they're supposed to do. There's a lack of common sense and a lack of common respect. But I agree with you. We need this belongs to the world. We need to learn to live with it. But when you get sick, stay home. Here's my policy at work. Anyone who comes to work sick, unless you're doing Zoom, if you come to work sick, you're fired. Done. In fact, I had that policy before. If you came to work with a cold, I usually fired that person. I have zero tolerance for incompetence. And to me, bringing a cold into a small office, because we had small office spaces, was not just disrespectful, it was totally incompetent. So you don't need to be employed with me. So quite honestly, I think any employee that walks into a building sick should be fired. They're not being loyal to the company, and nobody's that important. Nobody.
So what we can do is that in a large company, in a large mall, or in a large any gathering, what we can have is from the entry point, there should be a checkpoint should be there, where if somebody is not having the mask, if somebody is not having the hand sanitized, they can clean their hands, they can get entry. Yes, similarly what we see nowadays in India also, they had their bands before they enter into the certain kind of pubs or certain kinds of malls.
ID band.
So, ID bands, they are there. So that kind of things that can be taken care when we are entering in a large gatherings. If we have a suspicion that hey, this man is having the fever, or this man is suspected could be something fishy is there, better to isolate him, not to allow them to be enter into the large crowded place. And even in the large crowded place, there has to be maintenance of social distance. This virus has already told us many things, learned us many things, that we need to behave like a human being. We need to behave. Don't behave like a uneducated or uncivilized, unsocial person, getting together and spreading the disease from one person to the another. This is not the way to live. Live like a human being, and I think that's the way what virus wants, what God wants from us.
I mean, and I think if we just learn good behaviors again, the Native American Indians were really good about that too, right? Respect nature, period. That nothing on this earth belongs to us; it belongs to nature, and I think we just need to humble ourselves.
What we do in India, I mean, we have an agarbatti when we do the prayer. We burn that agarbatti, and that agarbatti is nothing but this is the ashes of all flowers. And then that agarbatti will give you a good smell around your house. And also we do a lot of prayer using fire.
Yes.
Just because to clean the environment.
Yeah, it's producing aroma. It's producing aroma. Yeah.
Create an aroma fire with agarbatti, and this is just to clear. So the old people will say that we have to purify ourselves. That means we have to do all these things. And that what is the purification? That purification is all about the unknown disease and unknown enemies which we don't know. So we think that fire god can manage it out with the aroma and with those fire and with those smoke, so they will go out. So that is what
it's high time. Yeah, it's high time. We should clear not only the external environment but also our internal mind also.
Yeah.
The COVID-19 is no more a taboo. One thing is very important from this platform. It's not a taboo. Either you or me at any point of time can catch this disease, and if somebody make a discrimination kind of thing from us, that's not a good thing for us. Being a doctor, whether me or somebody else, even with you being in you're at your role, you should be behaving with that patient in that dignity, with that manner only, which we deal with the other patients. So patient has to be deal with the patient point of view. We don't think that, it's a COVID patient, we should not get in close with that patient, or we should not allow them to enter into our lobby or entering into our society. The patient should be respected, and they should be properly that it's from your safety and from our safety point of view, it's better you should follow certain precautions, and you should be isolating yourself from the rest of the family members. I think this is a crux thing which in common people need to understand, these common things.
No, and I think you're right, and I think that realistically, we should make note that when something like this happens again, we need to get the infectious disease doctors up there, and that's who needs to be controlling the situation, not politicians, not the mayor or the governor. They're not doctors. We need real doctors that are up there talking about the real situation. That's the reason why Nigeria got control of their situation of Ebola before it got out of hand in 2014. It could have killed the whole country. It could have spread. But what they did was they just started, isolating and shutting down and putting people into this hospital. They knew that many were going to die. Fortunately, they had control of the situation, but they let doctors run the situation, not government. They let the doctors take control. I love the movie 93 Days. It is a true story. It is worth watching to understand how to control a disease that could kill the whole country in days. 93 days. This is what I told everyone. We're not going to shut down for a week or 4 weeks. We need to shut down for 90 days. It takes 3 months to cycle through anything to get it under control. And then you need to wait it out. See, once you get it done, you need not just say, okay, it's over. No, you need to wait a week or two to say it's over. We're too big of a rush for an instant gratification. That our country is all about instant gratification, and our society is about, I'm going to cook something with a microwave and boom, it doesn't taste as good with the microwave. I'm telling you.
I think Dr. Jatin would needs to leave now because
right, you got to go, and we got our.
Thank you.
So much.
Good night.
Bye. See you next time. Yeah.
Thank you.
Take care.
Yeah. Thank you.
We'll see you soon. Thank you. So, Lynn, you got a background noise. That's why I kept silencing.
No, that's okay. Sorry about that. Do you still hear it now?
Yeah.
A little bit.
A little bit? Oh, I'm sorry. I don't know what's...
It sounds like a bell going off.
It could be the wind outside with the chimes.
Okay.
It could be.
It's gone now, but it was
Okay.
a buzzing. There was a loud buzzing, and it sounded like. But anyway, I figured we'll get it in a minute. But hey, how are you doing today?
I'm doing great. And I have to say to you, because you can't tolerate incompetence, I know why you can't tolerate politicians. Sorry.
I agree with you, but I have a word for politics. You know, people of little intelligence taking infinite control syndrome.
Yes.
That's politics, right? People of little intelligence taking infinite control.
Syndrome. Got it. That's great. Maybe they can create some sort of a virus that it affects only politicians. What do you think about that one?
Well, I think it's pretty much there because I'm a little bit tired of them, you know, and I'm going to share this with you. You might get a kick out of this, but I received a letter from guess who?
Oh, okay.
I've received more than one. Okay, I've received more than one letter. Now I would be more impressed if he sent me a couple of these, right, or even toilet paper, right? Or better yet, a test kit box, right? A rapid test kit box that said, you know, hey, and do you mind donating to me? Because I would probably send him a couple $100 if he did that, right?
Mm-hmm.
But instead, he sends me a keychain.
Oh,
a plastic keychain that says I'm a member of his club, and he's asking me for $1,200. Go figure.
$1,200.
Well, see, previously to this letter, I received a letter that said, you know, thanks to him, I got the $1,200.
Right.
You know, and that we should remember that on election day.
Mm-hmm.
Right? And now he's struggling. He needs money to fund his campaign because the Democrats are taking over and, you know, going to take over the country and put a crushing ball on everything. But thanks to him, I got my $1,200, and he just gave me a key ring that says I'm in his club and he needs 12. Yeah, so, but this is my message to Trump. If you had sent out these things to everyone, not just people you're asking money from, but if you sent this to everyone in the mail, you know, a pack of them would have cost less than that. Or if you sent everyone, would cost about $10, a at-home test kit, so that you can test every day like he does, because he tests every day. I probably would have voted for you. As much as I don't like you, if he had taken that initiative, he would have won my vote and my support, because that's what I want. I want a person who's solutions. I don't want a political campaigner. I don't want a politician crying and whining and twittering all day long and pointing fingers at people and bullying people. I want solutions. I want answers. And
unfortunately, I think whichever side you pick, you're going to get something the same. So,
no, I agree. If you ever read my Facebook page, I don't like. I am so over the Republican and Democrat Party. I've been over it for 3 sessions of presidents. You know, and people say, well, you know, there's no one else to vote for. There's always been a third person that people get off.
But here's the thing. So I once said to one of the people that worked with me, why don't we just get rid of all of them? Wouldn't it be okay? Wait a minute. But then he said, what would you get? Because what happens is it all comes from down below. Okay, you can't see my hands. So it starts at local politics. These people are trained at local politics to be the same. So they go from local politics to regional politics to state politics, okay, and to federal politics.
Yeah,
so if you get rid of, you pretty much have to get rid of everybody in politics. And I'm not sure that can ever happen. Well, I know it can.
We can play Midsummer Murder Mysteries, right?
Yes.
You know, after 28 years, there's nobody left in the town because they killed everybody. If you ever watch Midsummer Murder Mysteries,
I haven't.
it's like 28 years of 28 years. And the guy said he finally came they did an interview with one of the stars that's been there the whole time. And he said, yeah, we finally decided that we killed everybody about 10 seasons ago, that there could not possibly be one person left in the town because every episode 3 people died, right? And but we could play Midsummer Murder Mysteries and maybe, but these two, I guess they weren't teenagers, but the 2 men that were on our show that have a really unique podcast, they don't want the politicians around anymore either. They think we need a new system, and that it shouldn't just be one leader that we need, and it's not like the Senate that we have. We need a team of people that work together, but not parties. And I've been done with parties for years, because all it is political party favors. No matter who gets in, it's about the favors, and it's never about you. It's never about me. It's never about the Globe. It's not about Ankit. It's about them. It's about, hey, you owe me a favor. Hey, you owe me money. Hey, I need money, and I'm over it. They have not done anything for our benefit in 50 to 100 years.
Here's the problem. Okay, if we would like to do term limitations just to change things, okay, or make significant changes, if it's not in their interest, they're not going to vote for it. And we need their vote to be able to make those changes. And then you get somebody who comes in who has all the best intentions, and they do want to make changes. And what happens? The seniority in Congress, well, they don't throw them out. They put them into a very menial a committee that has absolutely no power, and they diminish their capability to do anything.
Or they make them stupid, or they diminish their credibility, or they find a way to get arrested. No, it's all a sick game up there. That's why somebody's asked me several times to run for offices. I've been asked to do that for 20 years, and I'm like, are you crazy? There is no way, because the way I handle things, they will have me arrested. They will find a way to discredit me and make me look bad for all the good that I'm trying to do.
Right.
So this is what I tell people. I may not always, no, wait a minute. I'm almost never wrong, right? I do my research, I do my homework, and before I even step out to say anything about it, I'm going to have everything I can to back me up to make sure I'm right. And sometimes you're going to be wrong because your researchers might be wrong, or somebody, or things change the next day, but I'm okay with that. But I'm never politically right. I never handle the political situations democratically or republicanly. I will tell a snake a snake. I will call him a snake to his face, and that's not how it works. And I've been told, and I used to be really nice and eloquent. I used to be very, very eloquent, but that got lost somewhere one day. And so I'm just very point blank. And some people like that. They go, hey, will you run for office? You managed to save this area of the country, because now they're not going to, not the whole country, but our countryside here. Because I found a loophole where they couldn't overbuild certain capacities out here, which was a thing, right? And to save the watershed. So I found scientifically why they shouldn't do it. But you know how I really won?
How?
I proved to them how financially they would go under if they did it. It had nothing to do with the environment. But see, all the people around here, that was their whole campaign. We had scientists come in, we had all of these people do homework and research, and their whole pitch was you're going to destroy the environment, you're going to kill the animals, you're going to destroy our watershed. That's not why it went away. I sat down one-on-one with the head developers and everybody, and I went one-on-one, face-to-face with them, and I pulled up their financials, and I showed them where they were going to screw up. And that's when they did this, and they walked away.
Wow.
So it never has anything to do with the environment or the health. It's always about this. And even the mayor called me up and said, I don't know what you said to so-and-so. And so-and-so was very powerful, let me tell you. He was so powerful that I was getting death threats from the people. No, I was getting emails of death threats. People would come and destroy my front yard. Like, it was bad. They were blaming me, and I'm like, don't blame me. And so when they finally decided, it was a church. It was a mega church is what they wanted to build.
Right.
So when it all kind of wrapped up, and I basically won. I don't really consider I won. I consider that I convinced him the right thing to do.
Right.
I had to go to him and ask him to give a sermon at his mega church to tell the people that I didn't win. That because he goes, well, why, Kim? We're good. And I go, no, your people don't understand it. They're still threatening me and my family. They think that, and I said, so you need to get on the pulpit and you need to tell them why you made this decision.
Wow.
And you don't want to tell them because it was financial reasons, then tell them because you wanted to build somewhere else.
Wow.
And he couldn't understand. And I said, no, your people.
Oops. Sorry about that.
So it's always about the money. This COVID thing. So, but this is what I tell people. That's why I won't run for office, because you can't get the right thing done in this society situation that we have, and in our political system. You have to compromise everything. And I saw a lot of crooked things going on. I saw we had it set up where we were supposed to have a meeting with the city council about all of this, and they called us up and said, well, the meeting's been canceled. And I said, okay. So we had like 100 to 200 people ready to go, right, to go to the meeting. Mm-hmm. So they canceled it, but they didn't come back and tell us they rescheduled it for the next morning. See, it was for Monday.
Right, sure.
So they went and rescheduled, and then they said emergency meeting for Friday morning. So to get 200 people together to go into the next morning on a Friday morning, because they all work, all of these people out here work, was an act of God. I'm going to tell you right now, because here's what happened. I found out Thursday evening that they rescheduled the meeting. So I went out with a handful of people and we knocked on every citizen's door out here and begged them to take the morning off to come in. And so do you want to hear how crooked the system is? They didn't know that we found out that there was an emergency meeting. We show up with 200 people and it was a teeny tiny room.
Mm-hmm.
They thought that they were going to get all their agenda pushed through.
Right, sure. Because
they had this and power. And we walked in with 200 people, and the first words out of the city councilman's mouth was, if I hear one word out of you, Miss Calhoun, I'm going to have you arrested.
Wow.
And I don't cuss. I don't swear. The problem is I was going to put him in his place, lying to the people, and he didn't want to hear it. And so I stood down, but the only person that people wanted to speak was me. So that was kind of scary, because one word, I was going to get arrested.
Wow.
Because the people didn't know how to speak out. That they're all very educated out here, but they're all farmers, right? And they're all just workers and factory workers and stuff. So it was interesting. But I talked to your whole time. Let's talk about good things. Let's talk about saving money. Buying stuff. So I was just doing my shopping cart this morning.
Good.
Show started. So I was. Yeah. So I was adding before the show started. I was adding my napkins actually. So
your minion napkins. There you go.
So I did, but I realized I've got enough that I can hit the buy, so I can get my free shipping and everything.
Sure.
Let's talk about, the reason why this is such a great thing is, one, it's real easy to do. If you don't know how to get to the Shepherd Family Dollar Store, you can go to ibm.tv and push the big green button.
Correct.
And it takes you straight to toilet paper, actually, which I will fix that. I'll make sure it goes to the home page.
That's fine.
I thought it was great that it goes to toilet paper, because everybody around here keeps telling me, I don't have toilet paper. I need more toilet paper. And none of the stores have them, by the way. I did go do 2 store shoppings. One for the big store, hoping to get my flour, and the other was our small country store. And nobody has paper towels Nobody has toilet paper.
Paper goods.
None. No, and napkins. No napkins. No napkins. So I'm going to tell, I tell people, well, if you can't get it here, you can definitely get it at the dollar store. And if you buy in volume, certainly you'll get your shipping for free. So,
well, here's the thing. We give people discounts. We deliver to the house. We deliver for free for over $25 of purchases. We have a excuse me, a rewards program. So if somebody just signs up to become a customer. Sorry about the background noise. I don't. Could be my wife is downstairs working, and you might actually hear her talking.
That's okay.
But anyway, so oh, and by the way, it's my wife's birthday today. So
well, happy birthday! I hope you ordered her some good stuff, some Genesis lime reducers, and a good comfortable mask, a collagen mask, and some foot. You guys have got stuff for your feet too, foot socks with
right
mask in it. So you can definitely get a goodie supply here for a gift package. But happy birthday!
Yep. Well, a lot of people have been telling her that, but I'll tell you said the same thing, and Ankit too. Thank you. So people just by becoming customers can get a $5 discount on their first purchase. Every purchase thereafter is equivalent to $1 for every $10 they spend. And it's broken down, so 10 cents for every $1 they get in the way of a discount. They can use it anytime they want to. So why not buy stuff that's a whole lot cheaper? If you're into, if you want CBD patches, we have them. We actually have one now that came on this week. It's brand new, has lidocaine in it. And so that's a great patch because a lot of people, like my daughter-in-law, uses lidocaine patches for bad back, but now she can get them with both CD and lidocaine. So it's
a good thing. It really, really is. The combination of the two are very, very non-invasive to the body. And that's something else you have to think about. And I'm just going to share, I had to have a lot of medications over the years, and all the medications are very invasive to the body. This is non-invasive to the body, especially if you're doing it via the patch, right? And so you're doing what I call like trigger point injections, where you are putting the medicine right where the pain is at. And so it's very smart. But to get CBD and lidocaine, you get best of both worlds, And have you gotten yours in yet?
I have. I didn't order the lidocaine because it came in after I made my last order, but I do have the XL patches, and I can guarantee you, because it's going to be a nice day tomorrow, I will be using them because it's a day to work outside, and no baseball. This is using the shovel and the rake and all that kind of stuff. So I'll be using them tomorrow. And I'm looking forward to that. But no, we really do have great products. We have some products that are cheaper. And Dr. Markovitz suggested that we put quercetin on the site. And actually, I've had that conversation once. We're going to discuss it Monday night and see if we can get quercetin on the site because that really helps with people who have the COVID virus. So
it helps with the fatigue. I've been, in fact, I guess you're not going to get it in time. I'm going to go ahead and order some. And another thing is something we talked about today too, nitro. Hold on just a second if I can pull it up. Nitric oxide. And so nitric oxide is another supplement. If you're going to ask for supplements, it's a high dose of beetroot, which helps open up the blood vessels. And so it's very, very good. So if you're combining other supplements, and it was so funny because I was just getting ready to order it when Dr. Yu comes on, and he goes, yeah, and this promotes your nitric oxide, and he was going on into his spiel, and I'm going, oh my God, I can't wait till he's done because I'm going to tell him. And he goes, Kim, don't buy that. I'll just send you this, and this will promote your nitric oxide. And so Ankit wants one too. So Ankit's going to get one too. but this can be a device your store could sell. I got to go find out how much they are. But it's a device that you put on that pumps your muscles up and down like a cuff.
Right, sure. Like you're right.
But you wear it for 8 minutes. And it develops your nitric oxide boost.
So it actually, when you put it on, it actually expands and contracts and expands and contracts.
It's
Never
like
heard.
having a second heart, he said. It's like having a second heart.
How about that? So it's basically like a blood pressure cuff that you put on.
Yeah, and it's timed a certain way so that it pressures you and it opens, pressures you and opens, and you can put it on your legs too. So like diabetics or people with heart problems that have problems with their legs and blood circulation. That's all it's about, is increasing the blood circulation. But when you increase the blood circulation, you increase your nitric oxide, and your nitric oxide is what's very, very important for establishing the immune system. So one of the things I like about Dr. Yu is he's always finding these great tools. So here I was in the process of ordering it, and he's sitting here talking about it. But so if you can add these things, but I'm getting ready to order the Queer Synchron because I want to get over this fatigue. I'm really, really tired of it. And if I go to Dr. Markowitz and see him tomorrow and I haven't taken it, he's going to say, well, can you stop complaining to me about it? I'm not going to deal with anyone with incompetence. I told you how to fix it. So, I believe in following through. So when I give the chance to go out to the store, I've got to look for it. So I'm going to order and make sure I'm taking it. But definitely get it, because all of these things we can order from the dollar store, a whole lot cheaper. Then you don't have to go shopping, which is, I don't like to go shopping. So
one thing, and I agree that we should have it on the site as a supplement, but I will tell you, because my wife did a lot of research. First of all, quercetin is very high in blueberries are very high in quercetin, so you should eat blueberries. And red wine is exceptionally high in quercetin. So I'm proponent of drinking red wine, just for no other reason. I mean, you don't want to drink red wine except just to get your dose of quercetin.
Well, that and I guess all the other things that are good for your heart. And I will tell you a funny story about red wine. I was in the hospital recovering from that near fatal incident. And when I recovered, the doctors were talking to me because the reason why all my organs shut down was from all the painkillers that they gave me. Right.
Oh, wow.
So, and not just the painkillers, but all the other medications over the years. So, and so all my organs went ischemic. So one of my doctors, I have several doctors, comes in, and he's from India, actually. And he said, Kim, he goes, I want to talk to you about something. Now, my sister's sitting there, dearly, dearly love her. And she's sitting there, and she's listening to really hard, like he's getting, and he goes, from here on out, first, when you feel pain, have wine. It's very good for the heart. It will relax you. So start with a glass of wine first. If you need 2, go to 2. Then if that doesn't work, then take the pain medications, right? Now, I didn't OD on the pain medications. That was not the problem. It was just many years and use of them.
Sure.
I can never take an NSAID again. My organs shut down every time I take an NSAID. So here's what's funny. My sister goes, wine? Seriously? You're prescribing my sister wine? Can you put that in a prescription and give it to me? And I can get my insurance company to pay. This is my sister. We can get the insurance company to pay for our wine.
For a wine. Oh, that's funny.
So my sister, I can count on her to think of something like that, right?
That's funny.
Can you write that in a prescription? But you're right. Red wine is full of all of the things that are really. But you know, you can eat the blueberries. I grow blueberries. I'm hoping to get to them before the birds do. You know, grapes. Are
Kale is very good.
Capers. I hate capers,
Capers.
but it's a tablespoon of capers every day, and you don't need to take anything. That it has all of the quercetin in it that you need. So
The problem is if you have a blood pressure problem, all that salt in the capers is not good for you. So you have to find something else.
balance.
Yep, there's not a whole lot of salt in blueberries. I haven't found any salt. I look at every bottle of red wine I've ever drunk. There's no salt, so I check that just to make sure. So anyway, I'm kidding, but it is true. So
It is, and also just want to let people know I want to thank the Shepherd family because they donate from your shopping to us 50% because of our financial literacy program. Which, by the way, you know we do on Mondays. Actually, I think I found Monday to be very educational conversations. We actually did a great conversation on mortgages. In the United States, and I think he's coming back to do more. And we're engaging children's shows, and we're going to be incorporating financial literacy into the children's shows. So thank you very much for your support, Lynn. We are very appreciative for people like you who care. Thank you.
Thank you. Well, as you may have seen, because I included it in an email, I have a friend who does he's an investment advisor. But the very first thing on his list is financial literacy. So once he gets through the approvals, he wants to come on the program, and I understand Nick wants him to come on. So we'll get that taken care of, and he'll come on and talk about financial literacy as he sees it with his investment clients and even people that he just comes in contact with.
Well, because this is something that we need globally. It's not just the United States. This is something that can benefit anyone, anywhere, anytime. So, and we're going to have to wrap up because we got to teach somebody how to do their show this afternoon. And we thank you for your time. Where's our ambassador? I'll stop the share screen.
और ऐसे अपने खांसी जब आएगी तो ऐसे करेंगे अच्छू अच्छू और कोरोना वायरस को धन्यवाद हमारा म्यूजिक सुनने का
Namaste.
You know, that is a great way to wrap up.
It is. She is wonderful.
Thank you.
Anyway.
Thank you.
Thank you.
Thank you for joining us today on Medical Friday with Doctors. And it was a great show with great learning from across the different doctors of different specialties. And we're looking forward to see you tomorrow on a starry Saturday with a new show. Thank you very much. Stay blessed, stay calm, stay united. And thank you. Take care. Bye-bye.
Bye.